Morning, ladies and gentlemen. On behalf of the Vice Chancellor of the Rivers State University, want to welcome you to this special event. VC asked me to represent him here today. And I know that likely this is an event that has been on for a couple of years now, and I'm made to understand that this is the 4th edition of the annual Malaria Health Colloquium. The theme for this event is Innovate to Eliminate: New Strategies for Malaria Control and Elimination in Rivers State. Most of you are aware that a couple of days back, precisely on the 25th of April, the world marked the World Malaria Day. The theme, Malaria Ends With Us: Reinvest, Reimagine, and Reignite. The malaria scourge has been with us for as long as we can remember. Malaria, to me, looks like the great-grandfather of all the diseases we talk about in the tropics. However, over time, not much attention is given to its elimination, as other ailments seem to be stealing the show. However, we cannot shy away from discussing and focusing on this very important human ailment. It's therefore gratifying that we can have a forum like this to continue to beam the searchlight on malaria, particularly focusing on control and elimination, which is the focus in today's health colloquium. I want to say this is very apt and timely too. I've gone through the flyer for this event, and I can see that there is a collection, tested hands and tested minds here, that I believe will be doing justice to the issue of malaria control and elimination in our environment. The keynote speaker that have been chosen, the panelists, are all men and women who over the years have been involved at various levels of malaria control, malaria treatment, malaria elimination. On behalf of the Vice Chancellor, I want to welcome everyone to this occasion and wish you a very informative and resourceful session and interaction. And may the gains from the event today lead us closer to the deployment of better strategies for the control and elimination of malaria in Rivers State in our time. Thank you, and God bless you all.
Please, that clap is too small. Make it louder, make it louder. Sir, we have something for you, something very light. So we are not fit to present it to you. So in that regard, we'll call on our Dean, Faculty of Basic Clinical Sciences, College of Medical Sciences, River State, Professor Ibinabo Laura Oboro to come and help us do this. You can do better. Clap. Today you go clap. Oh. You go clap. We have about 2,000 more claps to go. So please do the honor.
Vice Chancellor, sir, on behalf of the ERENS with EKPRIKPO Foundation and partners, honored to present this plaque to you in recognition of your participation today as special guest of honor at this event, which marks the malaria annual celebration for 2025. Your leadership and commitment to academic excellence has inspired the efforts to promote innovative strategies for malaria control and elimination in Nigeria, River State in particular. So on behalf of them, I'd like to say congratulations, sir. Present this to you.
God bless you. Oh, and no, snap this, snap this, snap this, snap this. Don't waste this handshake. No, it's balanced now. It's balanced now. You don't snap. Thank you very much, sir. Thank you very much, sir. Snap. You know, for a few and pass through, please put yours together for our recipe. See this thing. You see, to whom much is given. Sometimes they pick your call, which is okay. But those that do pick your call, you appreciate them. Amen. Oh, you're pretending at church now. Amen. Must see that picture. In case police hold me for road, say no. I'm not a Yahoo boy. Look at me now. Ladies and gentlemen, let's at this point in time we'll make the chairman AMSIN UPTH, represented here by Comrade Want the Gift, to come and give us his speech. Put those hands together for him. Clap, clap. You can do better. You can do better.
Good morning, distinguished ladies and gentlemen. My name is Comrade Wadi Gift Nyebuchi, and I have the honor and privilege of representing scientist Mrs. Jeremiah Ngowa Yobuki, the chairman, Medical Laboratory Scientist of Nigeria, UPTH chapter, who due to unavoidable circumstance could not be here in person. On her behalf, I am pleased to deliver her keynote address to this esteemed gathering. Distinguished guests, esteemed speakers, participants, and the great ERENS Foundation, it is an honor to be here and extend warm greetings to everyone. The fourth Colloquium, whose focus is on new strategies for the control and elimination of malaria, is an inspiring one and appears loaded. As usual, the ERENS Foundation is at it again. I must say, your collective expertise and dedication to combating this devastating disease are truly inspiring. As we gather to share knowledge, discuss innovative approaches, and forge collaborations in this edition, I am confident that our collective efforts will bring us closer to a malaria-free world. The impact of malaria on our communities and individuals is profound, and the discussions here are crucial in addressing these global health challenges. I wish us all productive discussions, meaningful communications, and a renewed sense of purpose as we work together to control and eliminate malaria. May our deliberations yield actionable insights and strategies that will accelerate progress towards a future where malaria no longer poses a significant threat to humanity. Finally, to the ERENS PIP Foundation, I say once again, thank you for your tireless commitment to this cause. I look forward to the outcomes of your Colloquium and the positive impact they will have on global health. Best regards, Comrade Mrs. Jeremiah Ngowari, Amston UPTH chapter. Thank you so much for listening.
Thank you. Please don't go. Let's borrow a few seconds of your time. We have something light also for you, something very light. So to do the honors, let's make welcome quickly Pharmacist Promise Enyi Anele, PSN Chairman, River State, to do the honors. Clap, 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 clap. Yeah. He's putting on suit. That means he's suited for this job. I'm saying UPTH chairman, representative. Our mommy just walked in. So ladies and gentlemen, put those hands together for Dr. Vetty Angala, the executive secretary, Reef Chief. You can do better. Clap now. Clap, clap, clap. You're welcome.
My pain with his finger.
What a discovery. Aww. It's the song for me. So you're welcome, man. God bless you. In same vein, let's quickly make welcome. He's going to be claiming the second time. The PSN chairman, River State. Pharmacist Promise and to give us his opening remark. Jam those hands together for him. Clap, 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 clap. You know if the road is good, you follow it twice. This is your second coming.
All right, thank you very much. The special guest of honor for this wonderful event, our digital VC, ably represented by my own boss, Dr. D.S. Kukigam. I recognize you, sir. The keynote address speaker, brand new provost, College of Medicine, River State University, my Oga, Posodo, I recognize you, sir. Other members of that high table there, please, I recognize every one of us. The chairman or the coordinator board of fellows, PSN Rivers, Farm Mrs. Victoria Uku, FPSN, I recognize you, ma. And our acting mama in the house. Let's leave the other side. Dr. Vetty Agala, you're welcome. The panelists all seated here and all participants here. I want to, on behalf of the organizers of this program, welcome you But let me start by saying apologies that we're starting behind schedule. We had gathered here much earlier on, but we needed the hall to be a little bit sizable so that people will have to listen to this fantastic message that we have for us today. So on behalf of the organizers, which I represent, PSN, which is the Pharmaceutical Society of Nigeria, who is partnering with ERENS to do this.
So I love the way you spoke. You schooled abroad? Oh, it was deep. And I no feel am. God bless and only me. I love it. No. If you come in contact with Nigerian police, please don't use this voice. Yeah, speak the one to understand. Ladies and gentlemen, let's quickly make welcome the executive secretary, Reef Chief, Dr. Just clap. Dr. Vetsi Agala for our remark. Clap. Just keep clapping.
Yo, this is why Clef reps.
Good morning, everyone. Happy Workers' Day. Today is our day. We should have been resting, right? I pay homage to my ogas and madams at the top on this table, Professor Odru, Dr. Kukigam, my big brother up there, everyone, PSN. I didn't realize I was to give remarks. I thought I would just do a panel and run off. But I'm very excited to be here this morning to be part of the 4th colloquium and for the River State Contributory Health Protection Program to be a part of this. I want to commend ERENS for being consistent over the last 3-4 years to ensuring that we come together, we have conversations that can help us to actually reduce the burden. We've been having several conversations. We keep talking. But good a thing that this year the theme is talking about reinvesting, reimagining, you know. So we need to begin to look at what we have been doing so far. Is it working? Are there better ways to do it to be more efficient? And I'm hoping that today's conversation will help us to win this war against malaria. So once again, I want to welcome all of us and to say that the River State Contributory Health Protection Program is very excited to partner with this, because one of the commonest reasons that people go to the hospital and utilize our care is malaria. And that's why we thought it necessary to partner with ERENS this year to commemorate this year's World Malaria Day. So I look forward to very, very useful deliberations today, and hoping that the communique that will come out of this interaction will help us as a state to really actually bring down the burden of malaria, morbidity, mortality amongst our most vulnerable in River State. Thank you very much, and a warm welcome.
You can do better. Quickly, let's quickly make welcome our keynote speaker for today, the Provost College of Medical Sciences, River State University, Professor Kenneth S. Odudo, presents this award to our amiable doctor who just spoke. Keep that.
On behalf of the organizers, I present this to Dr. Betty Agala, one personal person. Congratulations.
Thank you.
Thank you, sir. That was straight to the point. I love it. And congratulations to you, ma. And we hope that you keep partnering with us to keep doing more of these, because people need to be aware of this thing called malaria. Now, we don't want to waste much of your time. I would like to call on our chief hosts, who happens to be very much under pressure. 1 minute is acting like an usher. The next minute is acting like a bouncer. Still trying to find his balance. Are you okay, sir? Can I call you up now? You're fine? But I'm checking for me. It's fine. Yeah. So ladies and gentlemen, let's make welcome our chief host for today, Mr. ERENS EKPRIKPO. Clap now. Clap.
Good morning, everybody. I'm the only one carrying a speech. It's very important that I do. So please permit me to I crave your indulgence, so please listen. Thank you very much. All right. The Vice Chancellor of the Rivers State University, Professor Isaac Zeb Obipi, here represented by our organ, our boss, the Director of Health Services, Department of Health Services Department, Rivers State University, Dr. Dagogo S. Kukiyam. Elders here, professors, healthcare professionals, lecturers here present, distinguished colleagues, students, volunteers, men of the press, ladies and gentlemen. To the glory of God Almighty and Jesus Christ, my Lord and Savior, I'm honored to stand here before you as the president of the ERENS EKPRIKPO Health Foundation and the co-convener of the 4th Malaria Annual Health Colloquium, with the theme, Innovate to Eliminate, New Strategies for Malaria Control and Elimination in Rivers State, Nigeria. As we gather here today, we are reminded of the urgent need to accelerate the efforts towards eliminating malaria, a disease that has plagued humanity for centuries. Our theme, Innovate to Eliminate, reflects our commitment to finding new and innovative solutions to the challenges we face, even in the River State where all of us are at this moment. Notably, our theme aligns perfectly with the World Health Organization's theme for the 2025 World Malaria Day, which is Malaria Ends With Us, Reinvest, Reimagine, and Reignite. This alignment underscores the importance of innovative solutions in the combat against malaria. The WHO's theme emphasizes the need for new tools, new strategies, new momentum to combat malaria. This colloquium will explore various aspects of malaria control and elimination, including digital health innovations, novel vector control methods, and community-based initiatives. These topics are all closely related to the WHO's emphasis on new tools and strategies for malaria control. Malaria remains a significant public health challenge in River State, which thousands of cases has been reported yearly. We are not here to lament the situation. We are here to innovate, to find solutions, and of course to eliminate malaria once and for all. Over the past years, there have been significant progress in the fight against malaria, which includes strengthening the surveillance systems, improving the diagnostic capabilities, and scaling up new and reliable treatment services in the state, all thanks to the unwavering support of the River State Ministry of Health and of course the River State government. This is why this event is so important to us. We've brought together experts from various fields to share their knowledge, experiences, innovative solutions, of course, to the challenges we face. As we move forward, we must recognize the importance of partnership and collaboration. We cannot eliminate malaria alone. We need the support and commitment of all stakeholders, including the government, civil society organizations, the private sector, and of course, we have one here today. Please let's celebrate the Nemel Pharmaceuticals Limited. Thank you very much. And of course, communities and community leaders. In the light of the above, I would like to thank my friend that I've worked with for several years now, Pharmacist Promise Aneli. He happens to be the chairman of the Pharmaceutical Society of Nigeria, River State. And of course, the Nigerian Medical Association. We are here, ma. Thank you very much. Please, I think the vice chairman is here. It will surprise you. Let me tell you who she is. Should I tell you? I will not tell you. She's here representing Dr. Diamond Tamunokoro. I think she will have a time to do a proper introduction of herself. You're welcome, ma. But her name also has Odu in it. So I think you guys should use your head. Thank you very much. All right. So also I would like to appreciate Scientist Ngowari Jeremiah, the chairman of the Association of Medical Laboratory Scientists of Nigeria, UPTH chapter. Thank you very much for this collaboration. And my own mommy, and someone that I've always pressured. I went to her office even before we started. Please let's celebrate Dr. Betty Agala. She's the executive secretary of the River State Contributory Health Protection Program. And of course, she has been doing very well. Thank you very much, ma. We are grateful. I thank you for your immense support and collaboration. I'll not fail to mention the indefatigable board members, volunteers of the ERENS EKPRIKPO Health Foundation, and most importantly, our esteemed media partners inside the Niger Delta TV. Please celebrate these people for me. I would want to say it here that this is our major media partners. And of course, thank you to your leadership and thank you to your management. Because with them, we'll amplify whatever we're doing here around and beyond the Niger Delta. On the national TVs, and of course, we should all tune in. Because with them, we are going to those places. Thank you once again, and God bless you. Their reach will help us amplify the message within and outside the Niger Delta. We're indeed very grateful for this partnership and hope to continue as we solidify this working relationship going forward. Before I conclude, I'd like to state that after this event, most people will say we'll just gather just to speak. But the ERENS EKPRIKPO Health Foundation is not about that. We are here together, just as Dr. Betty said. The communique would of course be communicated to the necessary authorities. And after that, of course, we'll have a major outreach to at least 3 local governments in River State with the highest burden of malaria. So with that, we'll be working with the River State Ministry of Health and of course with the Reef Chief, which my madam there represents, to see how we can curb this menace going forward. So on that note, I would like to thank you again for your support. Once again, our heartfelt gratitude goes to everyone that has made this event a success. My esteemed keynote speaker, our provost and my boss, Professor Kenneth Odu. Please, your hands together. He's our provost, and of course, he's my employer. If I misbehave, they query me. Thank you very much, sir, for honoring our invitation. Thank you. It's really a privilege, and we don't take it for granted. Thank you very much, sir. And all our guests, and our panelists, and our moderators. I just saw my man. I want to say this here. Your request is because of what you did last year. Please let's welcome Dr. Abi. Your hands together. He anchored our events last year, and the feedback we got was really insightful and, of course, very educative. So thank you again for honoring us, sir. God bless you. In closing, I want to leave you with a challenge. Let us make a commitment today to innovate to find new solutions and to eliminate malaria in River State. Let us work together to build a healthier, more prosperous future for our people. On this note, I would like to welcome and thank my family. They are here. Most people don't know my mom is a Calabari woman. There she is. Please do a wiper. That's my mother. And my brother, my other brother is there. His lovely wife and our family. Then my wonderful wife, my engine room. Please give the Lord a wiper. She has been the one behind my push. I appreciate you greatly. And I want to say I love you, baby girl. At this point, let me welcome you to the 4th Malaria Annual Health Colloquium. I wish you all a productive stay and an enriching experience. Once again, welcome to the Colloquium. Thank you.
You can do better. You just saw a man being celebrated by his family. See, if you're not doing well, your family will not celebrate you. Even in real life, if you're not doing well, on your birthday, they will not post your picture. Reality check, yes. If you're not doing well, on your birthday, they will not post your picture. But if you're doing well, they will post your picture. They'll be proud of you. So his family are proud. Mommy, God bless you. Do a wiper again. Wow, lovely. Mommy, do you know Spiff used to trek from Sangana to UST that year? He will always lie to us that he's burning carbohydrate. Say sugar. There's too much sugar in the system. He's burning it. And yeah, Spiff Heather brother is here. He came with his family. Please put your hands together for them. Celebrate them. Yeah. You're proud of your brother, right? You're very proud. That's good. I'm also proud. Very proud of him. At least, for one, they didn't catch us in exam hall for malpractice. Yeah, I'm very proud of that. Because we didn't do anything else. We didn't cheat. We didn't cheat in class. We are very good at what we do. We are very brilliant. And we have Mrs. ERENS EKPRIKPO. Please put your hands together for his wife. You can't do like this. You just do like this. No, do them. Oh, he said, I love you, baby girl. Oh, single people were just under pressure because of that line. I love you, baby girl. Now I feel your pain. I'm your colleague. It didn't touch me. You know, like, you know, you cannot relate. Certain things you cannot relate to. Yeah, you cannot. But we are here. We're here. So, ladies and gentlemen, where's this guy with my book? Go with my book. Now, while Spiff was giving that wonderful speech, some dignitaries walked in, and whether I like it or not, in life, for you to be celebrated, you must first of all celebrate others. True or false? Yeah, you must learn to celebrate others, because what goes around, that was before. Currently, what goes around is still looking for transport to come around. You know, while growing up, they tell us the safest means of transportation was transportation by land. Yeah, you know, bus and train. And it was very affordable. From Port Harcourt to Lagos was, I think, 4-5 by road. Yeah, that was before. Currently, the safest and cheapest means of transportation is by air. Yes, from here to Lagos, it's about 105,000 naira. Yeah, if you book on time. So transportation by road from here to Abuja is between 60 to 100 million naira, depending on the group that kidnap you. All right, ladies and gentlemen, we have here with us the chairman, NMA River State, humbly represented here by the vice chairman, Dr. Ure Opara Odu. Please put your hands together for her. Just wave, do a wiper, do a wiper. Now, also here with us, we have the Secretary, Nigerian Optometric Association, Dr. Oriva. Please put your hands together for him. Put your hands together for her. Sorry, there was no Mrs. there. Sorry, I was. Oh, okay. That was close. That was close. So we have other dignitaries here present too. So we have also Dr. Abie Tamuno Opubo. He is a specialist public health physician and chairman of the Association of Specialist Medical Doctors in Academics. Please put your hands together for Dr. Abie. If you're clapping, you can do better. We'll come back and introduce other persons. But for now, let's quickly make welcome our NMA chairman, humbly represented by the vice chairman, Dr. Ure Opora Odu, to come and give us our opening speech. Please put your hands together for her. Yeah, Opara Odu. You can do better now. Clap now. Come on. There's a doctor attached to it too. That means she studied out for it. God bless you.
Thank you very much. Good afternoon, everybody. First of all, I want to extend the apologies of the chairman, NMA River State, Dr. Diamond Tamnokuro, who unfortunately is unavoidably absent, but he insists that I should be here because this is very important, not just for River State, but basically around the nation. So my name is Dr. Uri Annabella Paradu. I'm the Vice Chairman 1 of NMA River State. Please permit me to stand on the already established protocol. But I would also like to specifically recognize the presence of my Vice Chancellor, who is ably represented here, and my indefatigable Provost, as well as the RIF Chief Executive Secretary. So NMA River State basically is excited about this program that we're going to do here, which is the 4th Malaria Annual Health Colloquium. We want to welcome everyone here because this is an avenue for us to be able to interact regards malaria in the nation. Let us see how we can come together, bring up new ideas, have discussions during the panel, and be able to figure out how we can collectively end malaria, as it were. How can we make things better in the state and in the nation? So at this juncture, I would like to say welcome to each and every one of us. May these interactions be a memorable one and one that will create impact in the future. Thank you very much.
Yeah, don't be worried to leave. Please put your hands together for her. Celebrate her, celebrate her, celebrate her. Now, just give me a few seconds. Ladies and gentlemen, we have also here with us Dr. Just be clapping, just be clapping. The head of special duties, Niger Delta Basin Development Authority, Dr. Kemel Layefa. Please put your hands together for. Don't do the clap now, him. Just keep clapping, keep clapping. Also, let's quickly make welcome the person I just introduced, Dr. Kemel Layefa, to come and do this honors of presenting this award to our speaker. Clap, you can do better. Double the clap now, double the clap, double the clap. Lovely, 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 lovely.
Well, good morning. On behalf of ERENS, EKPRIKPO Health Foundation and Pharmaceutical Society of Nigeria, River State, and in partnership with the Nigeria Medical Association, River State, I hereby present this certification of appreciation as a co-convener to Dr. Diamond Tamunokuro, Chairman, NMA River State. I so present.
Thank you very much. Yes, thank you. Because of this award, on your we'll give you 2 security van to protect you and the award. Yeah, we need. Ladies and gentlemen, also here with us, put those hands together for member Nigerian Optometric Association, Dr. Ezie Innocent Oprom. Please put your hands together for him. Okay, sorry. God bless you. My name is Brownson. At this point in time, sit tight, ready to listen and learn. I'll see you after this time out.
Celebrates a very good friend. Talks about how I used to trek. Exercise is good for you, isn't it? Don't mind them. They don't know these things. All right, thank you very much. My Vice Chancellor here, I think we've come to that place where we would have to now welcome our keynote speaker. But before then, let me appreciate Solve TV. Right now we are streaming live. Yes, we're streaming live. And the link will be passed across so you could share to your platform. Thank you very much, Mr. Woke. God bless you, sir. Also, let me celebrate the presence of Dr. Emmanuel Femi Fonsho Adebayo. Please, your hands together. I celebrate you greatly. Chief Executive, Health times 10 better. Please forgive me for if I didn't get it right. Please forgive me. All right. So, at this point, I would like to welcome my boss, the professor. And the thing about him is, if you're off the mic, Seth, you will hear his voice. A good man. Please, your hands together as we welcome our keynote speaker for this event, Professor Kenneth S. Odu, as he makes his way. Your hands together. Where is the DJ? Please, let's have his citation. Where's the DJ? Please, we'll have his citations. And of course, after that, he would now hand over, I'll hand over the mic, obviously. And of course, we'll start. Thank you for having us, Prof. God bless you.
Professor Kenneth Shelu Odu is a distinguished professor of anatomy with specialization in genetics, molecular reproductive biology, and development anatomy. As the current provost of the Rivers State University College of Medical Sciences, he has demonstrated exceptional leadership and expertise in medical education and research. With his impressive academic background and extensive experience in medical research, Professor Odu is the ideal keynote speaker for the fourth Malaria Annual Health Colloquium. His presentation on Innovate to Eliminate, New Strategies for Malaria Control and Elimination in Rivers State, Nigeria, promises to provide valuable insights and innovative solutions to combating malaria in the region. As a renowned researcher, Professor Odu has published numerous papers in reputable international and national journals. His research focus areas include genetics, molecular reproductive biology, and developmental anatomy, which have significant implications for understanding and controlling malaria. Professor Odu has coordinated the setting up of a state-of-the-art institutional collaborative research center in the College of Medical Sciences, Rivers State University. This center has facilitated cutting-edge research in various medical fields, including malaria. As an educator, Professor Odu has supervised several undergraduate and postgraduate students' research projects. He is committed to mentoring the next generation of medical professionals and researchers, ensuring that they are equipped with the knowledge and skills necessary to address the complex health challenges facing Nigeria. Professor Odu's professional affiliations include membership in the Anatomical Society of Nigeria and the Medical Dental Consultants Association of Nigeria. These affiliations demonstrate his commitment to staying updated on the latest developments in medical research and education. Please join me in welcoming Professor Kenneth Ordu as the keynote speaker for the 4th Malaria Annual Health Colloquium. His expertise, leadership and passion for medical research and education make him an excellent choice to address this critical topic. Ladies and gentlemen, please, with a standing ovation, let us welcome Professor Kenneth Ordu, Provost, College of Medical Sciences, River State University, as he takes the podium.
So on behalf of the organizers of this health colloquium, we want to present this certificate of appreciation. Congratulations, sir.
Sit down, please. We'll come after the talk. So that if the thing did not go well, it drop your it drop your appreciation. But of course, what it means is that whether I do well or not, I've already been appreciated. So you people just take it like that. Thank you very much. The Vice Chancellor, the Chairman of the occasion, and our amiable Vice Chancellor of the River State University, Professor Zeb, Professor Isaac Zeb OBP, ably represented my own personal person, Dr. T.S. Kukiga. When I call him personal person, you may not understand. Kukigam was the very first person that affected my life as a doctor. Sorry that I'm talking about Kukigam briefly, but it's necessary to state it. When I was doing house job in the then BMH, one of my colleagues, Dr. Brian, was covering his clinic. But Brian needed to go for youth service, and I was introduced to cover that clinic. That was how I got in contact with Dr. Kukigam. Immediately I came back from youth service, he employed me as a medical officer in the health service department of River State University. So my coming as a lecturer was my second coming to River State University. But something happened. They were not paying me, so I ran away. They owed me salary for 6 months. I said, this is not what I would do here. I begged him and ran to Uniport as a lecturer. But came back for sabbatical for anatomy when they were about to establish the medical school. That was how I came back. When I came back, I did not go back to Uniport again. So now, and that's in River State University. So Dr. Kukigam actually affected my life very positively. So thank you very much. Other my colleagues who are here, who have done so much on malaria and its prevention, Dr. Ebere, Professor Ebere, Dr. Walker, my dean, Dr. Ibnabo Oboro, the other professors who are here, the ERENS, EKPRIKPO Health Foundation, and every other partner with them, ladies and gentlemen. We are here to talk about something that is very, very critical to us, malaria. And the topic we are going to look at is innovation to eliminate new strategies in malaria control and elimination in River State. Yeah, of course, I'm the one that is standing here now to do it. The outline, please. That's the next slide. Good. I'm going to follow this outline, and I'll be as quick and brief as possible and straight to the point. If we define malaria, what is malaria? The man in the village defines malaria. The housewife in the house defines malaria. There is no person that doesn't have a definition of malaria. In fact, the definition of malaria comes with the definition of typhoid, because they will always come and say it is malaria and typhus. In fact, it's not even typhoid, typhus. So the person that has headache is the definition of malaria. The person that has body ache, he defines it as malaria. The person that mosquito beat the next day and could not sleep well because of the mosquito bite will tell you he has malaria. There are people who are even so obsessed with mosquito that if they see mosquito in their house, they will pursue it everywhere because they believe that even without one bite of mosquito will cause malaria. So malaria has been defined by many people in many ways. In fact, there is no person that cannot diagnose malaria. Every person that is seated here, even those that have not even gone to anywhere called hospital before, and have not even read anything that has to do with malaria, can define malaria. So there's hardly any person that have not heard the word malaria. But what is malaria? What is actually malaria? And that's why we're here. We must have to define this malaria. It's a potentially life-threatening infectious disease caused by parasites, mainly of the Plasmodium genus. They are transmitted to humans through the bites of infested female Anopheles mosquito. It's preventable and curable, but it can be serious if not treated quickly. So any sickness, any symptom that is developed because you are bit by female Anopheles mosquito, whatever symptom it is, be it fever, be it headache, body ache, but it's a direct cause of the multiplication of the Plasmodium in your blood due to the transferring by the bite of a female Anopheles mosquito. It's called malaria. It's simple enough and it's very common. But the worst part of it is that it's still killing people. In as much as all of us can diagnose malaria and can treat malaria, people are still dying of malaria. So it's common but still life-threatening. It sounds but very complex. Even those of us who are medical personnel, the first thing that will come to our mind, in medical school when we were as a house officer, your first diagnosis is malaria and you will never be wrong. Or when you are cracking a patient then, and then if there's fever and one or two things, you just put malaria first. You can put malaria and defend yourself. So they will not even harm you that much. So what it means is that every person can actually go into it. Of course, we said it is caused by a parasite called Plasmodium. It transmitted through. Of course, I know that many people have done many things about it. Is the mosquito, Anopheles mosquito, feed on blood. If they don't see blood, mainly blood of humans, they cannot be alive. As in, it's just like you now not eating the normal food that you eat to be alive. The mosquito itself feeds on blood. It's only blood. It's only your blood, my blood, that it is ready to swallow to be alive. Because if it's not deprived of blood, it cannot live up to its lifespan. So if you want to kill any mosquito, deprive it of blood. So because of that, there are many things it has all been developed by itself to make sure that it sucks your blood. The point is not even sucking your blood. As it's sucking your blood, it dashes you something. If he was to suck the blood, we wouldn't have minded. Of course, now suck the blood and go, because he cannot even get much blood that will even cause you harm if it is only the bite. But you do not transmit his own Plasmodium, a Plasmodium in you that will now immediately enters your body. That one start growing, and that will now want to cause the illness. Of course, the symptoms include my flu-like. It's flu because flu-like illnesses can actually be anything. It can be a cause by, it can be viral, it can be bacterial, it can actually be parasite. So you cannot even tag it to anything. So it's flu-like. It will range up to high fever, mainly in children under 5 and elderly and pregnant women. And then you also have chills, you have headache, you have muscle aches. In fact, these days, it comes in various ways. There are people who even have bone pain. So you cannot really define that this is the thing that comes exactly from malaria as a symptom. That causes a lot of complication if not treated very well. The next slide, please. Good. So now, because of this, the Rivers State government have been doing their bit to make sure. So the Rivers State government have existing strategy. Part of it is distribution of long-lasting insecticide-treated nets. Now, if you apply to the Ministry of Health, mainly organizations, you go there, they will dash you net for you to distribute free. Is it not? That is part of what the Rivers State government is doing to make sure that they eliminate and control this malaria. So, Rivers State government has distributed up to, mainly to the vulnerable, under 5 and the elderly, above 65, and the pregnant women. And that has been even in communities. In fact, many households have those things 3, 4. When you use one, some don't even know how to use it, and then, well, they teach them on how to use it, and many people sleep on the net. Some also don't like sleeping because of many other things that happens. So, 2, intermittent preventive treatment in pregnancy. Rivers State government alone has distributed up to 686,601 STDs. Now, when people are pregnant, they usually give them this fancial SP, that's in sulfonamide, to treat them twice in pregnancy. So they give the first dose and give the second dose just for preventive measures so that pregnancy cannot. So those things are actually what Rivers State government is doing so far. You know, our emphasis is on Rivers State. So that's why I'm calling down to what they are doing. There's also indoor residual spraying, which is not, many of this is more of the national one, where they give some insecticides. The Rivers State government has actually been distributing this to institutions everywhere to make sure that they control and eliminate malaria. Free malaria treatment. Most of the primary health centers provide free malaria treatment for children under 5 and over 65. They also have gotten access to ACTs. So if you also apply or write to the Rivers State government, they give you ACTs. Like, these ATCs are free and they have been paid for. That's artemisinin combined therapy. So they will give to you, and it's meant to be free, and they are doing it. So they also have provided 20,000 RUDT kits and 20 microscopes to health facilities in a way to strengthen the rapid diagnosis. So you go, they will put this thing and then take your blood, and then they can just get it at once. Not the one that we do with the microscope and then look at the parasite and count and know whether it's +1, +2, +3, or whatever. So those ones take time. But this one now is a rapid way of finding and then checking whether it has malaria. And immediately it is positive, they give you drug. These are strategies. Other intervention is community engagement, environmental management, and monitoring and evaluation that the Rivers State government have been doing. But despite this, next slide please. Despite this, malaria is despite what the Rivers State government is doing. All these we have mentioned. In fact, the money that have been budgeted to this is so much so that it has gotten up to 1.6 billion. But do we still have malaria? Yes. And the burden is still there. So it's still a public health concern. An estimate of 68 million cases reported, 194,000 deaths in 2021. 27% of cases of malaria in the world is from Nigeria. And 31% of death in the world is from Nigeria. We have stated what the state government is doing and what they've done. And we are still seeing that malaria is still killing people. It's still killing people very well. In fact, you may even think that malaria never kills any person again, but it's not true. People are still dying, even here in Port Harcourt, are still dying because of malaria. So there is an impact on children and pregnant women. As I've just said, so now there is high case of death rates, economic burden, as I've just mentioned, and you know that in the geographical distribution of malaria or mosquito and parasites, most of us in the south side are more likely because of our environment. Most of us who are in the swampy areas, we always have some problems. Now, what will happen? That is why today's topic has become very apt. Innovative strategies. Innovative strategies. So, what we are going to consider today is innovation means to think something new, to bring in something new to what you have been doing. Mainly since you have done so much and nothing has happened. Or if it has happened, it has not been significantly, the impact is not significant with what we are doing so far, with what we have been spending. So what are the innovative strategies? Number one is integrated vector control measure. Integrated vector control measure. Now, what is integrated vector control measure? Is an approach that combines chemical, biological, and physical methods in the control of mosquito populations. Now, that's why it is called integrated. Both the chemical, the biological means, and physical means to control the mosquito populations. And also, we know that there are places in the world where mosquito does not exist. Not that they cannot exist there, but because of what the people and the government have done. And then if there is no mosquito, there can never be malaria. But the point is, you know, many people even say, even when rat bite you, that it causes mosquito. So there are a lot of misunderstanding. In fact, mosquito can actually be attached to witchcraft and wizard. And you start binding many things. Even cockroach can be seen to be causing malaria. But it's not true. What causes malaria, as all of us know, is the mosquito. So if there is no mosquito, there will not be any malaria. It's as simple as that. Now, if we now use integrated vector control measure, which combines the chemical means, the biological means, and the physical methods in the control of malaria. This is actually recommended by World Health Organization. It involves using the insecticide-treated nets, indoor residual spraying, and larval source management. The insecticide treated net serves as the chemical. The larval source management serves as the physical, while the indoor residual spraying is the biological. So there is now a combination of these three things. So if we do this in integrated form, it is likely that if one escapes the chemical form, it cannot escape the physical form. If it escapes the physical biological form, it cannot escape the physical form. So that it is now integrated. So this is an innovative that are now being produced by WHO. What does this do? It has helped to controlling vector-borne diseases and involves multiple strategies to reduce vector populations through methods like larval source management, indoor residual spraying, and insecticide treated nets. 2, it prevents vector-human contact by promoting personal protection measures such as repellents and protective clothing. 3, it monitors. That is also involved in monitoring and adaptation, continuous monitoring of vector population, disease transmission, and intervention effectiveness to adjust strategies as needed. So you are using a physical means, you are using a biological means, and the chemical. And most of this will form the integrated vector management. Another one is larval source management. Yes. This involves identifying and controlling mosquito breeding sites. Now, where are mosquito breeding sites? In fact, it is even said that anywhere that any small little water gathers, mosquito can always breed there. It must not be a big river, a swamp. It must not be a very big water log. In fact, it is even said that even a horseshoe, when horse is passing and then it creates some impression on the ground, if rain falls and water gathers there, it is enough for mosquito breeding. So it is targeting this one now, targeting the larva. So if we target the larva and then control those sites, of course, if they are not producing again, they will not be mature to come and bite you. Are we understanding? So this approach has been effective in reducing malaria transmission in areas like rivers and Lagos State because of our swampy nature. Another innovation is community-based interventions, engaging the communities. In most of the communities, there are many ways to treat malaria. There is Abo. People heard of Abo. Yeah. That Abo, what I don't know is whether it's targeting malaria alone or every other thing. Because immediately any person is sick, it's Abo that is prescribed. Dogonyaro is there. Then they will go and plug lemon leaf and pawpaw leaf. Now, I ask myself, is it only this mosquito or this plasmodium that we want to kill with all these leaves? So the community, we have to go to the community and sit down with the people. As you can see there, preach this gospel. Go one-on-one and let us engage the people. Now, knowledge is power. And if they are actually aware of what is happening, they will take responsibility. And immediately they take responsibility. And not us giving them handouts every time. You go there, you give ACT, you give this, and without actually making them understand what is supposed to be done. You know, when you know what is supposed to be done, you can actually do it. So, training community health workers to track mosquito breeding sites using mobile technology. That is an innovation. So, where are all the breeding sites in this your community? If we use technology like the ZAP malaria software, can help identify and eliminate breeding sites. So with this software, in any community you go, the breeding site can actually be identified. And it will involve the community people before you can get to where these sites are. So the community must be involved. So there must be community-based intervention for us to get it right. Improve diagnosis and treatment. Improve diagnosis and treatment. You know, so our rapid diagnostic test, I have actually, as a person, discovered something. Most of the times when you do our rapid diagnosis and when it's negative, when they do the one that will look through the microscope, they see parasites. So there's actually a contradiction because that thing has happened to me once. We went for medical outreach, so we had rapid diagnostic kit. This guy, the fever with the temperature is up to 39 point something. And then we did this, it's negative. Okay, it's not malaria now. That's what that's supposed to suggest. We're supposed to be thinking other things. But when we now probe further, because we are concerned, I wanted to make sure that this, our rapid diagnosis, is some of the, you know, it is not dependent on whether the battery is new or not new, or how you kept your hand, or the position of your body as at the time when you are checking it. Why I'm bringing up this is we are here to think. We are here to innovate. We are here to make sure that malaria is eliminated. Let me not just say control. Eliminated. Is it really possible in this our climate? Is it not possible that malaria can be eliminated? It is possible, but are we? What it means that we are not actually doing exactly what we are supposed to do. What is the source of those rapid diagnostic tests? Who imported them? Is it even the originals they gave to us? What I am here is a keynote speaker just to throw up questions so that the discussions will answer the questions. That's my own function. No? So don't expect me to be answering as I'm asking you. So how did we procure this? The ACTs we have now, we give ACT. As you give ACT today, in fact, the malaria, the symptom will increase. It will increase. As the person is taking the drug, the person is getting sick more. The pharmacists that are here, what are we going to do to produce the correct? Maybe if in our own river state, our drugs supposed to be different. You know, I'm into genetics. I wanted to do, okay, we are setting up something to do the genetic profile of mosquitoes in different geopolitical zones. And see, if the genetic profiles are not the same, even if it is female Anopheles mosquito, which is, even if Plasmodium falciparum, which we have known the genus, I am thinking in the proposal that there can be actually some genetic manipulations. Why the mosquitoes are not, or the parasites are not responding to the drug, or we are not giving the drugs that are original. How do we now know the one that is original? How do we come up with drugs that when you take it, when we were small, there are these yellow quinine that if you put it in your mouth, before it goes out, you will drink and begin to do. Immediately you take that in that time, you get well. If you are able to swallow it, you get well. The problem is swallowing. But swallow it, you get well. These days, those things, are they still working? Where are we? What can we do? What can happen? Is there nothing that can happen? Can't we gather and really take a close look at this? Prosperity is here. You have mosquito everywhere around you that you are breeding. In fact, while we are talking there, we are asking him how does he feed those mosquitoes that he put in all those his bucket. He said what he does is that once in a while he put his hand inside there so that they can bite him and take the blood, because since he's using them for research, they will not die. And they cannot come and take your blood and put there now. And I say, Oga, you strong, go. He said, no, those mosquitoes that he's breeding, that are sterile, that they cannot cause. I said, okay, no wonder. So, because of course we have established here that for the mosquito to be alive, it must take blood. And the organ that is breeding, they know that one. So maybe 1 or 2 days he put his hand, they will suck blood to be alive. Then he will remove his hand. After like 1 or 2 days again, he go and put his hand so that they can get something to be alive. Okay? All of us into genetics, all of us in the lab, all of us producing drugs. And I think it has to be something that we will do by ourselves, not depending on what people will bring for us. I think that's what is happening. The health system and the health workers, let us innovate. In our own locality, find something that works for us. Even if it is above, let us, not just because we want to do a research to become professors. No. Not just want to do something to get something somewhere. Somebody will sponsor you and get more money. No. But let it be that we are actually, even if that leaves you, let another person continue. But I think if we actually are committed to it, we'll find a solution to this thing. And not in on the Western world. Because I have come there now that I've been using. It's either we are failing as bring them, or they are failing us as they are bringing it. Those are the two things. Because if it's in their own client, mosquito is not there, and our own will be doing what they've been telling us to do, mosquito is still here. There must be something wrong somewhere. Don't you think so? There must be something wrong. Innovation to eliminate. So something must come out of this place today, as we are thinking. And then there must be more practical ways that if you call all of us, we should be able to bring up, sleep, wake, think of something, do something that will make these things work. And the thing can work. I believe it can work. It's something we can do for ourselves. It's something we can do for ourselves. So, prompt treatment. Well, it's crucial, such as artemisinin-based combination therapy can help reduce the transmission. Then another one is supplementary vector control methods. The vector control, we have already, like all the diagram that there are people wearing masks, trying to wear something to protect. Then the larva is there, what you do. Now, another thing we can do is to strengthen the existing strategies. Like as I've just said, these strategies, let's look inwards. Where do we store those ACTs in the ministry? How long have they been there? How long did it take to ship it from wherever it got to where we are taking it? What is the cold chain like? What is the temperature like? Because it's as if you are just drinking chalk. It's as if you are not even helping yourself. Why you take those drugs? How do we strengthen this thing? Let us look inwards again. These things we are doing. The insecticide treated net, are we really, is it in the right proportion? People that are using it, are they actually following the correct procedures? Do you just bring it and then you put in your place and then you rub it somewhere? Some people even leave it outside for 3 days, 4 days, that they cannot sleep there, that is peppering their body. What? There must be something that if we strengthen with what we're already doing and we are spending so much money in, we can get a result. So we are going to think. I know there are capable people here to think about the innovations to eliminate and to control malaria. Thank you, and God bless all of you.
When I feel you pull me higher, you want me.
Put your hands together once again for our own keynote speaker, Professor Kenneth S. Odu. Your hands together as he makes his way back to his seats. Please, I think we should stand and honor this man for a very well delivered keynote speech. Thank you very much, sir. Thank you very much, Professor. Of course, it was no mistake that you are the man for today. God bless you, sir. Your hands again together. Thank you so much, sir. The Vice Chancellor here, represented by Dr. Kukigam. At this point, I would like to also honor the presence of the Postgraduate Student Association President, Right Honorable Oberejima White. Please give us a wiper. He's here. Your hands together for him. You're welcome. It will interest you to see that the water itself is from ROSU. So we are thinking. If you look at your water, it's from our university. You know, we are here to think. Thank you very much, sir. There's a comedian in the house too of the Federal Republic of Nigeria. His name is GSN. He's also here. Your hands together for GSN. Thank you for honoring us. There's a lot to eat. There's a lot to drink. In fact, what we kept for people is, I think people will carry two. So please don't rush to go. Today is public holiday. Let's enjoy our stay here. All right, at this point, we'll be having our panel sessions. And of course, we have erudite scholars here to discuss. Ushers, please let's get the chairs ready. And of course, we'll have their sessions. So the way it will go is, we'll call you on, we'll recite your citation, we'll present an appreciation just to kill time. Immediately, then we'll go into the sessions. So the first session is up. Then after the first session, Nimel Pharmaceuticals will do a 10-minute presentation of their product. Then we'll have the second session, and we are closed. You know, but the problem is that I hope we don't just live here. We go and we innovate to eliminate indeed. At this point, let me welcome my friend and brother, MC Brownson. Your hands together for him now.
Thank you. Please, a round of applause for our keynote speaker. God bless you. You know, you raised a whole lot of stuff, and you said the Rivers State government has spent over 1.6 billion to fight ordinary mosquito. 1.6 billion to fight ordinary mosquito. What did they do us? They have done us nothing. Now, if it's just to fight mosquito, we have spent 1.6 billion. Imagine when we decide to fight cockroach, sandfly. Now imagine how much we will spend just to fight. It's like it is humans against the animal kingdom. We are going to lose. And you said we are here to think. Okay. Now, you said the River State government has also provided a lot of things to fight mosquito. Do you know why it is difficult to fight mosquito in this country? I've been thinking. So have you visited Iwofe? Have you visited Iwofe? The mosquitoes in Iwofe are the reason why it is hard to fight mosquitoes. They will just come. They will attack you. They will be like 10. With your mosquito net, they will be like 10. They will attack you. Within you, you thought you have this protection. Net is protecting you. What they'll do is, they go in badge by badge. 5 will first of all raise the mosquito nets. The other 5 will enter and suck your blood. When they are done, they will come out. The other 5 will go in. That's the problem. That's the problem. And you say we should ask people in those countries that don't have mosquitoes. The secret. I'll tell you the secret. It's simple. The only reason why we don't have mosquitoes in certain countries is because those countries keep denying visa application of those mosquitoes. They don't give them visa. Are you surprised? Okay, I don't trust man. Okay. So ladies and gentlemen, that was a very wonderful. I learned something, I learned a lot. So I believe you learned something too. Put your hands together for our speaker. That was awesome. So ladies and gentlemen, introducing our first panelist for today. Put his hands together for calm down. Calm down. Yeah, who is also going to act as our moderator for this first section. Ladies and gentlemen, put those hands together for Dr. Anyekan Afia. Yeah. You love the way he speaks. Come on. Clap. Now, that is for him. Now, clap for his voice. Come on. Come on. God bless you, sir. Yes. You're welcome. You're welcome. Also to join him, ladies and gentlemen. No, I don't call who they speak Yankee. Let me flow. Put those hands together for Professor Ebere Nwabweze. Clap. Oh, I know what I'm saying. Clap.
Professor Ebere Nwabweze is a renowned academic and researcher in the field of environmental biology, specializing in entomology. As a professor at the River State University, he has made significant contributions to the field of environmental science and management. Professor Nwabweze currently serves as the head of Department of Maritime Science at the River State University. However, his expertise and passion lie in entomology, where he has dedicated his career to harnessing the potential of insects for a more sustainable future. As an esteemed professor of environmental biology, Professor Nwabweze conducts impactful research, educates future generations, and actively engages in community development initiatives. He holds a PhD in applied entomology, highlighting his deep understanding of insects and their diverse roles within ecosystems. His research findings are published in esteemed journals and presented at international conferences, earning him recognition as a leading authority in his field. His Google Scholar profile, with many citations, demonstrates the impactful reach of his work. Professor Nwabweze's passion extends beyond research as he inspires the next generation of entomologists through his dedicated teaching efforts. At River State University, he fosters a stimulating learning environment, sharing his knowledge and expertise with undergraduate and postgraduate students. He is known for his engaging lectures, insightful guidance, and unwavering support for his students' research endeavors. Professor Nwabweze recognizes the importance of translating scientific knowledge into practical solutions. He actively engages with local communities, educating them about the significance of insects and providing guidance on sustainable practices related to agriculture, pest management, and disease prevention. This community engagement ensures the direct application of his research findings for positive social impact. Please join me in welcoming Professor Ebere Nwabweze as a distinguished panelist at the 4th Malaria Annual Health Colloquium, where he will share his insights on novel vector control methods, exploring new approaches to controlling malaria-carrying mosquitoes.
Please a round of applause for him once again. Sir, before we proceed, we have something very light for you also. So let's make welcome one of my lecturers back then in university, Dr. Easter Nwoka, to come and do the honors. You can do better.
Why do you ask me to present a very what if I run away with you? All right, so on behalf of the ERENS Health Foundation, this is a certificate of appreciation as a panelist presented to Professor Ebere Nwabweze. in recognition of your invaluable contribution as a panelist at the fourth Malaria Annual Health Colloquium held today at this very, very center. So I still present. Thank you.
Thank you, sir. Thank you, sir. God bless it. That is something light for you. Something light. Yeah, I talked about the mosquito larva basket outside this office. I wasn't lying. Reality. So am I lying? Exactly. Ladies and gentlemen, also to come and join our list of panelists, put those hands together for our very own Mr. Daniel Ekpo. Yeah, he's our tech guy. Digital health innovations, leveraging technology
A
to
visionary
enhance malaria
product manager,
surveillance.
ICT consultant, and cybersecurity expert, has made a profound impact in the tech industry through his innovative solutions and expertise. With a master's degree in computer science from River State University and certifications from Google and the Institute of Commercial Management, UK, Daniel has established himself as a thought leader in digital marketing, technology solutions, and cybersecurity. As a seasoned IT professional, Daniel has extensive experience in software development, training delivery, and IT management. He is a skilled software instructor, executive coach, and IT specialist with expertise in administration, networking, and security. Daniel is also a passionate advocate for Web3, DeFi, and blockchain technology, actively engaging with the evolving ecosystem and exploring its vast potential. A proficient developer, Daniel writes in PHP and Python and is deeply involved in the WordPress community, Google developer groups, and 4Loop Africa Tech PH. His commitment to community development and knowledge sharing has earned him recognition as a community leader and mentor. Beyond his technical prowess, Daniel is a life coach, experienced event manager, and community leader, inspiring others through his expertise and passion. He is a member of the International Association of Engineers, demonstrating his dedication to professional excellence and continuous learning. Please join me in welcoming Daniel Ekpo as a distinguished panelist at this 4th Malaria Annual Health Colloquium, where he will share his expertise and insights on leveraging technology to combat malaria and improve healthcare outcomes.
Jam those hands together for him once again. So before you take your seat, we have something also very light for you. So to do the honors, let's make welcome the AFS chairman, River State, scientist Mewari Jumbo. Please put your hands together for her. Yeah, she's going to do the honors of presenting this award to him.
You want to take it first?
Good afternoon. In this 2025, we are not limited by resources because almost everybody has a mobile device, and technology has touched even the remote part of Nigeria. I mean, you go to your communities, your village, community leaders have mobile devices. So how can we leverage on technology for reporting? Yes. Okay, so basically, like our keynote speaker said, you cannot find these sources where the breeding of mosquitoes are found in these communities without the people located in the vicinities there. Now, how do we use intelligence? We have the medical AI, which does what the human does. It doesn't sleep, it doesn't rest. It can answer all your questions as fast as you can type it. It gives you the answer. So now, if we have the AI and we have the people in the village, how do we match these two people together? We use the mobile devices. Smart mobile devices. Sorry, let me be specific. Smart mobile devices. Because if I say mobile device, we still have the button phones. Yes, touchlight phones. So smart mobile devices. we have applications. The World Health Organizations, they're already doing so much in this aspect. So much in this aspect. And so much is done, and so much can also be done. Now, we have an application. I am trying not to be too technical. We have an application, DHIS2, that they are using to track the mosquito population, the mosquito, their growth, and also what they are, where they are coming from, when they are stemming from, the larva and all that. So with this, it helps you to figure out, with the help of the community leaders, yes, figure out where the mosquitoes are stemming from and where they are coming from, and then you can now track and then eliminate them at the larva stage, eliminate them at the mature stage, the adult stage as well. Now, with AI, the data is collected from these community leaders and then put into a system, which is an application or a WhatsApp group, or sent via email or whatever to the right authorities, and then they use it to handle the infest of mosquitoes.
What will you advise the government to do in terms of this trying to collaborate between the local community people and these innovations that you just talked about?
Okay. I think if I understand you clearly, you're asking how would the government, assuming, collaborate with the community leaders without a mobile device?
Yeah, I mean, most of them don't have the mobile devices in the rural areas, and you know that most at times, it's endemic more in rural areas. I think the burden would be more in rural areas because of hygiene and all that, and vegetations, and so
advanced. Basic being how to use a mobile device, how to use a laptop, how to use a system, how to understand the software inside the system, how to understand the software, how to understand the information gathered and sent from other communities, because it's a hierarchy. It comes from the lowest communities to maybe the CDC chairman and up to the local government areas, but it gets to state government. So how to understand the information, because as the information keeps coming higher, it becomes more complex. As it keeps coming higher, it becomes more complex. So the training is important, and provision of the devices are also important as well. Thank you.
All right. Okay. So I just brought that up because the Lagos state government currently, they are having real-time surveillance about mosquito burdened areas, real time, as they plug the data, how many people are ill in this local government, they are getting it directly at the command center. And so I feel that that's it. So we have situations where they are
go to the field. They have the smart phones and other things. And also there's use of drones. Although we've not started using drones, it's also very, very important in mapping. Yes, mapping of these vectors, because when you want to control, you want to have information about the density, the type of mosquitoes that are found in such areas, the prevailing environmental conditions. There are a lot of things they are going to put into consideration. So it's a very good way. I mean, it's an innovative approach to this. But what I'm telling you that we have started doing this at Bonnie.
Okay. A round of applause for that. Okay. My second question will be, what are the challenges and opportunities in using mobile apps for malaria diagnosis and treatment adherence? What are the challenges and opportunities in using mobile apps for malaria diagnosis and treatment adherence?
Okay, first of all, the challenges would be knowledge gap, because in as much as you try to train the individuals that are involved, you cannot completely eliminate the unseriousness of individuals. You can't take that out. Of application used as well. Who developed the application? Okay, most applications developed are complex to use. No matter how much you train and retrain, it is difficult for the person you're training to assimilate how to use this application. Do you understand? Okay, good. Now, for what I wrote down here, I'm looking at it. Okay, yes. Now, for data collection, it, okay, before I go to data collection, there was something I wanted to say to Prof. Prof, sir, we believe that everything has advantage and disadvantage, and malaria has a lot of disadvantages. I've been thinking, what are the advantages of mosquito? Sorry, not malaria, mosquito. What are the advantages of mosquito? Everything has advantages and disadvantages. So what are the advantages of mosquito?
Okay, you done? Okay. Thank you very much, Mr. Ekpo, for joining us. Now we'll go to our next panelist, Professor Ebere. Now the topic, novel vector control methods, exploring new approaches to controlling malaria-carrying mosquitoes. Novel vector control methods, exploring new approaches. Okay. Okay, so the first question is, what are the most promising new vector control methods being developed, and what are the potential challenges to their implementation? What are the most promising new vector control methods being developed, and what are the potential challenges to their implementation? Prof.
Yes, we are talking of novel vector control methods. You are all aware from the last, when the keynote speaker spoke about vector control measures. We have existing vector control measures like use of IRS, use of larvicidin, we have larval source management, we have area spraying, we have personal protection, but all these things have challenges. You see, there are a lot of challenges caused by this. One of the major challenges is the issue of resistance. I'm coming to a question. Issue of resistance. You see, almost all the insecticides are not effective because of the resistance of these vectors. Apart from that, you have the problem of environmental degradation and others. So that's why we are now looking for innovative method of vector control. You all know that vector control measures mostly rely on the use of chemicals. And these chemicals have disappointed us, resulting to problems in vector control. And that's why we are looking for a new measure, new vector control approaches that will be compatible with the environment and also can be integrated with our vector management. So there are a lot. We have the gene drive technology. We have the Wobacha, use of Wobacha bacteria. You have the sugar-based solution. You have the enhanced net. The net we are using, we have problem with the nets now, which you all know, that the nets are not more effective. So there's need again, they have innovative, they have chemicals now that we are using to impregnate nets. You have a lot of them. So you talk of the gene drive. You all know that in when we go to we have the genetics, the gene, talk about genetics. In Mendelian law, you have the inheritance. What happens? So during these things, they incorporate gene, like in gene drive. They insert gene known as what's the name of the gene? They insert certain genes that will now modify the genetic, the DNA structure of that particular organism. We feed them with sugar and also blood. Mosquito can survive without blood. The male mosquitoes do not feed on blood. They are the ones that normally dance, the one we slap our ears. They are the male mosquitoes. The female too can survive, but they need the blood for the development of their eggs. They don't need their blood for food. They don't need their blood for anything. Without blood, their eggs cannot develop. That's why they take blood meal. And of course, when they do that, they can now reproduce. You have a lot of them. We mass rear them in the lab, first generation, second generation. So they mass rear these mosquitoes, then sterilize them. After that, they now release them into the wild population to mate with the wild species, into the population to mate with the wild species. In the process, when they mate, no zygote will be produced. You see, in that case, you reduce malaria transmission. We also have this Wolbachia bacteria, where the bacteria there that can be also used to control these mosquitoes. We have the use of drugs. There are drugs now, ivermectin, the drug that we use to cure elephantiasis. That drugs now, that's an innovative method, can be taken. And this one protects you against mosquito bite. Mosquito cannot, the bite, the parasite cannot reproduce, cannot survive. And so the parasite dies. It's also a new method. We have sugar-based solution, STB, where they put
the first question I asked, new methods of control. So we'll just keep that gene editing. We've already heard it from you. Now, what I want to ask, what are the potential environmental and health impacts of using nanotechnology for vector control?
The environmental impact is that. Okay. Hello. Yeah, for nanotechnology, there is a great fear that if these things now enter into the ecosystem, after a long while, there could be mutation whereby it continues affecting the population of these insects. You know, they are all very, very important. Like somebody said, what's the importance of mosquito? Mosquito also plays a role in pollination, but we are not talking about that. So these things now can also affect the ecosystem because they are check and balance. And most of them may also affect non-target organisms. Non-target organisms, which may be very, very useful to us. Like as I told you, an ecosystem, we have check and balance. We have other organisms that are checking other ones to make sure there's a balance. When you disrupt that ecosystem, it will make the other one now to thrive and also cause problem. And another one is the acceptance. I mean the community acceptance again, the ethical approval and you know, some people may not like it, that you are introducing nanoparticles, that this may happen, this may happen. So you have that problem, that ethical problem. So these are the major problems of using some of these technologies.
All right, thank you very much, Prof, for that expository comments. Please, we would like to do this open now. The house, if there are any questions you have for any of the two panelists we have here, this is the right time to ask. So are there any questions from anywhere? Any questions to any of our panelists? Yes, there's a hand at the back. Any other question? Any other question for our panelists?
Hello. Thank you very much, Prof. and my brother. My question, listening to you and the keynote speaker, we are already used to malaria being in this region. In fact, it's becoming a major issue, or it is a major issue. How come we have not, there has not been proper research towards vaccine to say we can be vaccinated and for 1 year, 6 months, 5 years, 10 years, 20 years? Because if these issues that we are being faced in this part of the world is happening in the US or in the UK or any well-developed country, they would have developed some certain things. So my question directly is, what is the processes or what's the major challenge in producing vaccine since we have this major?
I became a victim of early stage of elephantiasis as a result. I was told later that caused by malaria. I'm still surprised till now. Several years ago, around 2013, 2014, I woke up, sorry, I need to take this a little bit so that you can clarify me. I'm not a medical person. I woke up one very early morning, Sunday, and was feverish. All of a sudden, my left leg got swollen, bloated, and almost 3 times the size, this other size. I moved. I tried everything possible to make sure I look for a solution to it. Oh, they said I've matched medicine. Oh, you have done this. Oh, I went there. Even the medical doctors couldn't help me, you know, until I had to take a lot of pills, you know, to stabilize myself, got myself. And I'm talking to you, I'm still on it for 6 days. I started taking ivermectin until COVID broke out. And they said ivermectin, the price for ivermectin went up. Now it has come down. But that was how I was able to survive. My question is, are there other things? I wanted to even add to what he has said. What do we do to inoculate ourselves away from mosquitoes? Because I'm on ivermectin now for the past 4 years plus. And then time to time, when the symptom wants to come up again, I quickly help myself because I wouldn't want it to come. If I have been on it for these years and somehow I still want to feel that malaria thing, then I believe that the ivermectin thing you mentioned, is it really going to work? So what do we do at this point? Because I'm a victim of such. They said a specific kind of mosquito
that we've adopted all these years have failed. But I don't know. I'm thinking that there is actually one of the challenge that we have decided to leave behind. And that is talking about the quality of these reagents or materials, the chemicals that we have used, we've been using all these while. How good are they? How viable are they? Don't you think also the government have not decided to do the need? If these methods were adopted in some countries and it worked out perfectly well for them, don't you think the NAFDAC also and any other organization or body that should be checkmating some of these things to know if actually viable enough, instead of leaving it to individuals, let me say VDM, the very dark man, to keep doing what they are supposed to do, calling on NAFDAC, telling them this is substandard and all that. So to me, I would say that these methods have been working for so many European countries, and they've asked us to also adopt the same methods. Why now do we say that these methods have failed? I think it is the work of the government to help. Thank you.
I want to thank the panelists for the thought-provoking discussions they've been giving. My question is directed to Prof. You mentioned that there are, in ecosystem, there is this check and balance of a thing. And I'm thinking, are there kind of birds or kind of animals that feeds on these mosquitoes that can help reduce their population? That's my question. Thank you.
Hello? Yeah, we have what's known as biological control. In biological control, use organisms to control another organism. And mosquitoes have predators. So these predators feed on them, like in the larvae day, is because we tamper with the ecosystem. Everything God created has a natural enemy. There was a weed, we are coming back to your question, in I think Queensland, that devastated that area for years. They spent millions of dollars, carried out mechanical control, chemical control, physical. It was not possible. But it was only when they went back to the origin of that pest, they found out a particular insect species that normally feed on them. They imported that insect species, the insect species, into the country, mass reared them, and released them to the environment. It destroyed
the whole week to today. Even the water hyacinth problem we're having today, the water hyacinth is an exotic species. We are looking for the natural enemy. Once we get the natural enemies, we introduce them and the water hyacinth will go. Look at Nipa palm taking over the mangrove ecosystem. So these are the things we use biological control. We can use all these organisms to control the mosquitoes. It's one of the measures. Then elephantiasis 40 can transmit this disease. 40 species of Anopheles. And in this our own area, we have Anopheles gambiae SS. We have Anopheles funessus. We have Anopheles calosi. We have Anopheles millers. We have Anopheles arabiensis. In this part of the country, River State is mostly Anopheles gambiae SS. We only have few arabiensis, and we have gone around the state. I've been in surveillance, been working as a principal since 2009. So I've gone around the whole state. I know the mosquito species everywhere in this state. So we've done all those things. So God is wonderful, as I used to tell students. Look at only one female Anopheles to bite us and look at the problems we have. But this one, every mosquito that bites you can give you elephantiasis. I have my students also working. I have people, Brandon, Bonnie, they are just working, looking at the mosquito species that carry this. And they also find out that these mosquitoes, both Anopheles, can transmit this disease. But the only problem is that it needs repeated bite of that particular mosquito over a time before it can give you. And it takes about 3 years before it develops. That is why it is not easy to notice them early. So when you start noticing, that's why we are, the WHO is talking about deworming, all those dirty environment. That's where I get the Colloquium fasciatus. They are the primary vectors of elephantiasis. But all mosquitoes, whether Aedes, whether Anopheles, whether Culex, can transmit elephantiasis. So then, the other one is quality of the reagents. You see, this thing is just that the beaming is live. There are a lot of politics too in these things. You rely on funding agencies. I have to do the bidding. We have been testing insecticides over years, since 2009, as a principal investigator for the state on malaria vector control. We have undergone training. We have been testing insecticides. The one you use here, we recommend. We test insecticides. There are chemicals that are very effective. 100%, the vectors are 100% susceptible. We have done that. Have they recommended those chemicals? Have they done it? You have pyrethroids. The vectors are developed resistant to pyrethroids. We have been testing. What are you not still using pyrethroids? River State carried out biolavicidin. I was the principal investigator for that biolavicidin. You go to WHO, do they talk of that biolavicidin? They won't talk about it. That's why I think was very effective, because it's Cuban products. So there are a lot of politics. I don't want to go into that because it's this thing. I am an insider. I know what's happening in terms of this thing. So, like, I'm the principal for Bonnie Malaria, LNG Bonnie Malaria Elimination Project. We have developed a net they are using. Because we tested these nets, we found out that the vectors are resistant to the chemicals which they use in impregnating the nets. We have, and if they want to do IRS, based on the ones that are affected that we're going to recommend. So that is the thing. Even when the state, when we did the first IRS there, I was still the principal investigator of the IRS, which did in the Kwara and Eche. Before we use those chemicals, we carried out solidity tests. And when we found out that some insecticide like the bifenthrin was no more effective, we advised the federal government and they withdrew that insecticide. We monitor, even after application, you also have to monitor. So that is evidence-based. You have to monitor, carry out these things, test them before you do it. But I don't know of the drugs, the medical doctors, they are here. But a lot of politics, Anyway, God will help us.
Well, you know, the last, the usual last statement for every problem, we are looking for solution in this country. One last question. Okay, just a minute. The usual thing at the end is God will help us. God will help us. You know, God will help us. How will God help you if by your own efforts. I mean, we are aware of what these problems are. Some years, I'm also a member of the Center for Malaria Research and Phytomedicine in the University of Port Harcourt, and we do a lot of diagnostic testing to see the efficacies, especially of the RDTs you stated. And when we went to the store some years ago, River State store by by the MPA, I can tell you for free that the tests we carried out there, over 70% of the RDT kits that they had stored for use were ineffective. And this is, if you open the store, it's fully loaded. Even the way it was stored is already a way to dwindle down or reduce efficacy, if at all it was effective initially. So, I mean, there are a lot of things that we need to do as people, and we need to be conscious about the efforts that are being made in this regard. Nobody can do it for us. If we are determined to do it, we can actually do it by dealing with empirical facts. Empirical facts. The testing kits, to treatments, to map out areas, you know, the kind of species we have, all those things together is what the people in the Western world will use to develop their own protocol. And we must learn to domicile our thing. It's not just follow foreign people. This is what they do there, then you jump up and follow. We need to domesticate our own strategies, our own procedures, so that we can have outcomes that are tailored for our benefit and not for the benefit of those that are sponsoring us. Having said that, we say we have one last question. I just want to we have to be very please, we are out of time. Okay. What was it? Sorry. Vaccine. Okay.
What he asks is almost the same thing. What actually I wanted to ask. I remain Dr. Omoni Beke Kemalaifa. Well, to still Prof, you said something about the resistance of the mosquito, some of the chemicals and insecticides that is being used on them. Well, we know mosquito, they are very simple, in their actions very complex. So I'm just thinking now, since we say we want to do it in our own way, if it is possible to innovate something that will strengthen our home body system, if possible too, for we to be resistant to the mosquito bite too. If such innovation too can take place, it will go a long way to help our own system too. Thank you.
I know that some years ago the WHO had moved. They said we are moving to dealing with the vector itself than with the disease. And I think that over the years we have lost focus on. Over the years, after that initial facing the vector, I've forgotten what the team was, but it was about dealing with the vector so that it doesn't even get to the point where it starts transmitting. I think that we've reneged a little on that push, and so it's something that we must think about holistically, and that's why these sessions like this are good to rekindle our awareness, rekindle our drive to move down the scourge of this disease. Prof, you want to say something?
I think I mentioned it as one of the innovative approach. If it's just that I thought I would have made the presentations, and they're all there. Where now they take this drug, you take in the drug, and the parasite will no more develop. Is there? It's one of the innovative approaches that I mentioned. Maybe when they share the slides, you will see those approaches.
All right, thank you very much. I want to thank especially Mr. Ekpo and Professor Ebere for handling this session very well. Please, we want to give you a round. We want to give them a round of applause and say thank you very much. And we hope that we don't just listen, but we listen and we act accordingly. For those in policy making, the strata of policy making, you have heard what we've said. For those in the lower cadre, in terms of teaching, in terms of enlightenment programs and all that, you have heard what we've talked about innovations, these innovations we have. Let us use these phones. Let us use this AI. Let us use all that we have, all the resources we have when it comes to innovative resources. Let us see how we can put that to good use and fight this malaria to a standstill. Thank you very much, and God bless us all.
Put your hands together for them. They did a very good job. Very, very good job. Ah. Oh, malaria. Malaria, I won't get resistance. Lovely, lovely. Thank you, thank you, thank you, Mr. David Ekpo and Dr. Professor Iberi Nwabweze. So, ladies and gentlemen, since we came, we've been listening to something educative. All they've been saying is educative. At this point in time, I think it's only right we just take a little break and enjoy ourselves. So let's treat ourselves to this moment where we can, wow, this scale is good, this thing is good. So, ladies and gentlemen, let's make welcome the poets. Clap, 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 just clap. Should come. Keep clapping, keep clapping, keep clapping. Just keep clapping, she will. Now, when she comes up, I would like you all to listen attentively. In this part of the world, we're only used to comedy, jokes and musicians, saxophonists. It's high time we explore other side and encourage them to. So, are you ready for us? Are you ready? So, ladies and gentlemen, one more time, give it up for her. Clap, clap, encourage her, encourage her. It's not easy to come and do this.
Good afternoon, distinguished ladies and gentlemen. The first time I got kissed was by these tiny little creatures called mosquitoes. I had blisters all over my body, itches and discomfort. All comfort. Seems like attaining comfort in our current society sounds far-fetched. But these carriers of pain are always eager to fetch from the stream of life flowing through my vein. I have never seen a lover this persistent, one who doesn't take no for an answer. Every night I'm forcefully made to take a blood oath, but my blood is used to make the deal. So what do I stand to gain in all of these? Malaria, deadly yet treated lightly. We are called the giants of Africa, yet these tiny little creatures gradually invade our territories and leaving everything in shatters. Our gutters have now become a breed site for these haters. Our blood a feeding site for these monsters. Day by day, infection rates increase, all because of this poison, this venom they release. I have never seen a monster this terrible. The mosquito. So what do I stand to gain in all of these? I used to think this was a disease for those overseas, but no. Until my little ones and nieces began to act weak. Very active junior began to act weak. I guess this seems worse than the sting of bees. Yes, the sting of bees. The sting of the mosquito stings because the pain it brings takes away the smiles on my face. And here comes the artemetallumethrin. No, I don't want any of these. So what do I stand to do? What can I do in all of these? And so here I am. I say no to malaria. I say no to mosquitoes infesting my area. And with one accord, we promise to keep our environments clean, to stay clean, to reduce these infestations, and to stay malaria free. Thank you.
You can do better. You can do better. Hello, hello. Come. Keep clapping. Woo! Malaria that stings overseas. This thing. You forgot to tell us your name. So what's your name?
My name is Festa John Morrison.
Calm down. What's this? Sorry, my name is Festa John. Did you hear yourself? No. Now calm down. Say it slowly. Some of us would like to identify with you after here. Because the stings overseas make you, what the seas? So say it one more time.
My name is Festa John Morrison.
Put your hands together for Festa John Morrison. God bless you. Stings overseas. If mosquito don't bite you before, you go forget the stings overseas. Stings, is it harder than a bee? That line, take it personal. Yeah, mosquito stings harder than bees. So ladies and gentlemen, very soon something will get to you on your table. Sit tight. Like they say in pidgin, too much talk need a full basket. So we have something for you. Refreshment, very light. Eat, make merry, and get yourself ready for the second session. But before then, let's make welcome Nimel Pharmaceutical Nigeria Limited to come and do their product presentation for just 10 minutes. So while you're eating and drinking, don't forget that mosquito may later come at night to come and eat and drink. No, it's not, the ecosystem is like this now. It's a fact. So, Nimel Pharmaceuticals Nigeria Limited, can we have you for 10 minutes? Bros, you have to smile. You're looking too serious. Yeah. It's a very good song.
Thank you very much. Good afternoon, everybody. My name is Onyekachi Ajibo, the regional manager of Nimel Pharmaceuticals Limited, South and Southeast. Really appreciate you, everybody who have gathered here today for this colloquium. We are very appreciative of the fact that also we are partner in this making for Rivers State government in the control and the elimination of malaria. I'm also very happy here that we represent the private sector too, just like the former speaker said somehow. So we are proudly Nigerian. Nimel Pharmaceuticals, who are indigenous, located in Enugu. Please, NIMEL, empowering life and well-being. While we are talking on the control and elimination of malaria, NIMEL has also come with innovation on the treatment of malaria. At least we have ACT, artemisinin combination therapy. We also have the SP, and two of these products were mentioned by the VC, ably represented by one of us here. So NIMEL has those two products that we are talking about. And as we are saying, achievement, we are first to locally manufacture cefixime and this dispersible. First to locally manufacture paracetamol dispersible. First to locally manufacture extended release metformin. First to present PPI tablet dosage form in Nigeria. So while we have come with that innovation in treatment of malaria, we came with ACT. We know most of the one we have suspensions, but NIMEL came with dispersible tablets so that it can effectively control and treat malaria, especially among the children. And that's why, at least, is an innovation in what we are doing today to eliminating and controlling of malaria. So, no, go back. So, a dispersible tablet, in this, I want to tell you there's a different advantage between the suspension and the dispersible tablet. A dispersible tablet is a type of oral dosage form that is designed to dissolve or disperse quickly in water, making it easy to administer, especially pediatric patients, elderly individuals, or those who have difficulty in swallowing tablets. So it's also observed that there's high acceptability of dispersible tablet formulation by children, and concluded that this proposed child-friendly dosage form provides a convenient option for oral drug administration. Next slide. Next slide. It's here. So indeed, this advantage of a tablet over suspension, convenience and ease of use. Dispersible tablets are easy to administer, especially for children and elderly patients who may have difficulty swallowing, that I've said earlier. Improved accuracy and compliance. You know, when you are measuring suspension, especially with the cup, you discover even if you are asked for 10 mils, sometimes you may not adequately get that 10 mils. But for that accurate dosaging, using a dispersible tablet, just dispersing it in the water immediately, it gives you the accurate dosage required for that treatment of malaria. Better stability and shelf life. Dispersible tablets are generally more stable and have a longer shelf life compared to suspension, which can be prone to certain aggregation and microbial growth. We know in our country today, power is one of the major problems we are facing. Most of our households, especially in rural area, find it difficult to have access to this. Especially not only just even refrigerator, so that when it has been constituted, you can at least refrigerate and keep it there. But with dispersible tablets, it's easy to keep. Each time you want to administer to children, you just get it and place it on the cup with water, and it dissolves quickly, and you give the person. Reduce risk of dosing error. Dispersible tablet minimize the risk of dosing error as the patient cannot accidentally take too much or too little of the medication. Bioavailability, portability, and storage, just like I've said, in storage using refrigerator, no need of a refrigerator. So you just, anytime you want to use, cost effective. Dispersible tablet can be more cost effective than suspension, as they eliminate the need for bulky packaging. And while we carry big cartons of suspension, just a pack of 10 of ours is just enough, very portable to carry in your bags than carrying a carton of suspension while you're going. So dosage and administration of Laretin DT. The treatment is administered 2 times daily for 3 days on 0-1. The first dose is given out on 0 hour, and the second dosage 8 to 12 hours, assuming you take by 10, the next dosage starts by 6, and you continue 6 until the dosage is completed. So why the man came with this, we now made it in many ranges. We have the one, mind you, this are so why we came with this, we had age differences in management or treatment of malaria between 1 to 5, 5 to 15, 15 to 25, 25 to 35, then 35 above the adults. So Nime came with this innovation with dispersible 5 to down, that 5 to down takes 2 tablets. 2 tablets, that's by 12. 25, having kg of 25 to 35 is 18 tablets. Then 35 is that dot. We made it that all the ranges we have is by dispersible. Why we have this? Because of this, I have showed you the ranges we have, but notwithstanding, we have it at the back of this stage, where we have all the ranges lying together. So Nimel is very happy to partner with you, and we pray that we keep on partnering with you. Thank you very much. Please, to the representative from the government, we have ACT in every ranges. We have also SP in SP in our own office. Nimel is probably Nigerians, and we will be glad if you continue to patronize Nimel brands. Thank you very much.
Put your hands together for him. Yeah, someone asked about indigenous, ways of combating malaria, and I think Nimel has a solution to that question. Ladies and gentlemen, before we go into the second section of this program, where's our, has he gone? Yeah, during the time the keynote speaker was giving his speech, he made mention about Agbo. Agbo, he said they used to cure malaria. Sir, it's not malaria they use it to cure. Let me explain. We don't use to cure malaria. Practically, tomorrow in the morning, get up, just outside your gate, put anything in the bottle, root, or in the name of Agbo, and be shaking it. You will see like 4 men will approach you. Bros, they walk. So it's not malaria we use Agbo to cure. We know. So ladies and gentlemen, I would like to invite our moderator for the panel section 2. Put us together for our very own Dr. Abie Opubo. You can do better. You can do better. Dr. Abie. Also, no, it should just sit. Keep clapping, keep clapping, keep clapping, keep clapping. So, ladies and gentlemen, let's also make welcome our first panelist for this second session. Put us together for our very own pharmacist, Quanta Roland.
A visionary leader and dedicated healthcare professional, has made significant contributions to the field of pharmacy and public health in Nigeria. As State Coordinator for Drugs and Substance Abuse Control at the Rivers State Ministry of Health, she has played a crucial role in shaping policies and programs aimed at combating substance abuse and promoting healthy lifestyles. A seasoned pharmacist with expertise in HIV logistics, pharmacovigilance and clinical pharmacy, Pharm Roland has served in various capacities, including as HIV Logistics Officer for the River State's AIDS and STIs Control Program and Pharmacovigilance Focal Person for the River State Ministry of Health. A Fellow of the West African Postgraduate College of Pharmacists, Pharmacist Roland Rowland is also a respected leader in professional pharmacy organizations, serving as Vice Chairman of the Association of Hospital and Administrative Pharmacists of Nigeria, River State Chapter, and Deputy Coordinator of the Clinical Pharmacist Association of Nigeria, River State Chapter. As a preceptor for pharmacy residents, Pharmacist Rowland has mentored and inspired the next generation of pharmacists, imparting her knowledge, skills, and passion for the profession. Please join me in welcoming Pharmacist Quanta Rowland as a distinguished panelist at this 4th Malaria Annual Health Colloquium, where she will lead a pivotal discussion on next generation anti-malaria medicines, developing new, more effective treatments.
Please, you're welcome. Please don't go. We have something very light for you. And to do the honors, let's make welcome Pharmacist Mrs. Victoria Oku, FPSN Coordinator, Board of Fellows, River State.
Good afternoon, everyone. I'm so happy to present this to my colleague. Yes, Pharmacist Quanta Rowland, this is a certificate of appreciation as a panelist in this program, being presented to you by the organizers of this program. Congratulations.
God bless you. Ladies and gentlemen, to join us here upstage, put those hands together as I make welcome someone that taught me, and he taught me very well. Very, very well. Give it up for our very own. Be clapping. Dr. Easter Godwin.
Associate Professor Easter Godwin Walker, a renowned medical microbiologist and distinguished scholar, has made profound contributions to the fight against infectious diseases. With expertise in pathogen genomics, antimicrobial resistance, and biorisk management, he has published extensively in reputable scientific journals and served in various technical committees and professional organizations. As the coordinator of the Molecular Biology Unit and chairman of the Departmental Entrepreneurship Unit at River State University, Associate Professor Walker has demonstrated exceptional leadership and administrative skills. He is also a certified biosafety professional with double certification from the International Federation of Biosafety Associations, IFBA, Canada, and a certified biorisk management trainer with access to the Global Biorisk Management Curriculum Library. Associate Professor Walker has played a crucial role in promoting biosafety and combating antimicrobial resistance globally. He serves as the Director of Publications at the AMR Scientific Hub in Nigeria, Ashin, and has assisted in coordinating workshops and trainings. His expertise has been recognized nationally and internationally, including his involvement in COVID-19 diagnosis since 2020 and his service as the River State Coordinator for the supportive supervision and assessment of malaria diagnosis implementation and stability monitoring studies. A fellow of several professional organizations, Associate Professor Walker has held key positions including State Chairman of the Association of Medical Laboratory Scientists of Nigeria, AMLSN, River State Branch, and National Secretary of the Nigerian Biological Safety Association, NIPSA. He is also a global mentor under the IFBA Global Mentorship Program. Please join me in welcoming Associate Professor Easter Godwin Walker as a distinguished panelist at the 4th Malaria Annual Health Colloquium, where he will present a thought-provoking discussion on research and development, cutting-edge research on malaria vaccines, diagnosis and transmission blocking strategies.
Put us together once again for our Associate Prof. As usual, we have something. I lobbied to present it to you, but they rigged me out. My INEC chairman is not trying. Ladies and gentlemen, to present this award to... Oh, you are already here. This is not just balance. Continue.
On behalf of the organizers of the 4th Malaria Annual Health Colloquium, I present to you a certificate of appreciation to Dr. Easter Walker as a panelist. Congratulations, sir.
Thank you. Thank you. Very, very active and proactive lady. Before I say she was already there. Ladies and gentlemen, also to join us upstage here, put us together and make welcome Dr. Vetty Agala.
Dr. Vetty Agala is a distinguished healthcare professional and administrator, currently serving as the Acting Executive Secretary of the River State Contributory Health Protection Program, RIVCHPP. With her expertise in healthcare management and insurance, Dr. Agala has been instrumental in enhancing access to quality healthcare services in River State. As a panelist at the 4th Malaria Annual Health Colloquium, Dr. Agala will share her insights on innovative financing models for malaria control with a focus on the role of health insurance programs in improving access to malaria prevention and treatment services. Her experience in designing and implementing health insurance programs, particularly the RIVCHPP, will provide valuable perspectives on this crucial topic. Dr. Agala's commitment to universal health coverage is evident in her work with RIVCHPP, which aims to provide affordable health insurance to all residents of River State. Her leadership has been instrumental in strengthening health insurance systems, as demonstrated by her participation in the first quarter 2025 forum of SSHIAs held in Abuja, Nigeria. Please join me in welcoming Dr. Vetty Agala as a distinguished panelist at this 4th Malaria Annual Health Colloquium. Her expertise and experience in healthcare management and insurance will undoubtedly enrich the discussion on innovative financing models for malaria control.
Thank you very much. All right, Ma, you have something already, so you sit. Thank you very much. Your hands together for all our panelists. All right, so before we proceed, let me just do these honors. Inside the Niger Delta is our sole media partner, and they intend to take whatever we're doing to the national scale. So it's only good and it's only wisdom that we honor them. So at this point, the representative from the inside the Niger Delta, please, we'll need you to come forward for this appreciation. Please, your hands together as they make their way. And also, I've been working with people. You see our media presence on our website, and also you see them on our social media handles. This we don't generate. People work for us. For the last 4 years, some very special has been working with us to make you see us wherever the spaces of the social medias and all those media are. I would like to celebrate her today. She's the female official photographer of the ERENS EKPRIKPO Health Foundation. And there she is. Please, let's celebrate her. And if you look at behind the book, you will see that the board of the ERENS EKPRIKPO Health Foundation is made of all women. There's a reason for it. Give a woman something to take, she would expand and produce more. Maybe that's why we're having all this. Celebrate women now. Thank you. So please, let's perform my bellow as I present this certificate of appreciation, while the PGSA president will help me present that for Inside the Niger Delta. Thank you. This is a certificate of appreciation to former Miss, she's not married yet though, so please, if you are interested, come and see me. Miss Ufoma Bello, official photographer of EEHF, in recognition of your outstanding contributions as our official photographer of the ERENS EKPRIKPO Health Foundation. For the past 4 years, your exceptional skills, professionalism, dedication have captured the essence of our events, preserving memories and promoting our mission to advancing healthcare in River State. Your work has not only showcased the foundation's activity, but has also inspired others to join our cause. We are grateful and we encourage you to do more. Thank you. Digital people, thank you very much. Please, let's welcome the postgraduate students president, Right Honorable Obara Jima White, as he does these honors for us. Please, inside the Niger Delta, please, we will need you now, please, to receive this award, please. Please, 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 thank you. Inside the Niger Delta, your representative, please. Thank you.
Ladies and gentlemen, on behalf of the President, EKPRIKPO Foundation, and the organizers of today's event, I'm glad to present this on their behalf for the work you've been doing with them, your partnership with them. We believe that in the nearest future, we will be on the national scale and, of course, the global scale. Congratulations for this recognition, and God bless you.
Good afternoon, ladies and gentlemen. This session will be a lot brief because of time constraints. We have three panelists who are authorities in all the areas they're going to talk about. For pharmacist Quanta Rowland, in the previous panel section, even up to the keynote speaker, we've seen that malaria is hyper-endemic in this part of the world. Malaria is likened to be a scourge. And then over the years, we've had different generations of anti-malaria. These generations are not sustainable in terms of drug resistance. And even the latest ones we are talking about, the ACTs, are also, resisted by the so-called malaria parasite. So your question is this: as part of innovation, effective innovation strategies, I have to put the word effective. It's very key to me, because we've had a lot of innovations which do not stand the test of time. And so, as a pharmacist, looking at the enormity of the burden of malaria disease and the economic issues around it, the issue around out-of-pocket expenditure for healthcare is not sustainable. And these anti-malaria products are up expensive for the average citizens to get. And then they come back, you get treated for malaria. The next time you're still frail, you're still febrile, you're still weak, lethargic. People keep treating malaria with different things, and malaria still persists. As a pharmacist, what can effective control measures, in terms of adopting effective control measures, what are the current challenges you have in developing effective anti-malaria medications? And how do you, intend to address them? And then are there also knowledge gaps in terms of research? Are there collaborations you need to, make in terms of the usual town and gown relationship? Because there are a lot of isolated researches ongoing at different spots, but there is no constellation of all these research protocols that are put in place and executed. People do things on their own. The pharmaceutical companies will do theirs and all that. Prof here talked about a lot of researches done. So how much of that collaboration have you been able to, garner to enable you come up with effective anti-malaria? Thank you.
All right, thank you very much for that question. And I like to say, tackling the burden of malaria, or let me rephrase or recast, the hallmark of tackling the endemic prevalence of malaria is not particularly on the rediscovery or discovery of a novel anti-malarial molecule, because if we're talking about how we'll be able to eliminate the burden of malaria, I think we have to explore a multi-pronged approach to the elimination of malaria. However, talking about the pharmaceutical intervention, as a nation, we are faced with so many challenges. Currently, in the treatment of uncomplicated malaria, we're using the ACTs as the first treatment line. Okay, so we're talking about the artemisinin-based regimens. Then as prophylaxis, we're considering the sulfadoxine and primetamine. I know they're not bigger words because we're all healthcare professionals here, or most of us are healthcare professionals. So in the first line therapy, we're talking about the artemisinin-based combination regimen. And as prophylaxis, we're using the sulfadoxine primetamine combination. Then for complicated malaria, we're using basically quinine, we're using the alpha beta arteita. In the treatment of malaria, these molecules have been used over the years, and we keep developing new ones basically because of the issue of resistance that we're grappling with as a nation currently. So even with the artemisinin-based combination, we're still having issues of resistance. Now, the pharmacist in drug development, there are many issues you're considering. You're considering diverse issues. You're considering the material they're using. If I use this material to formulate this medication, is it stable? We have so many artemether lumefantrine suspensions in our pharmacies, in our clinics, that we even give to patients. But it will surprise us to know that there is no ACT suspension that is effective as we speak in country. Why? As a result of stability. And so I'm happy when the company Nemel made their presentation and they talked about the dispersible formulation. Perfect. So in your development of drug, you're considering the solubility of the substance you're using. You're considering the stability of the product you're using. You're considering how this molecule will be able to permeate tissues and cells. Then, of course, you talk about the efficacy of the molecule. You talk about the safety of the molecule, among other things that you'll be considering. So, why are we where we are today? It may not necessarily be that the molecule artemether lumefantrine is ineffective. We go to clinics where the prescriber, the physician prescribes artemether lumefantrine. You go to maybe the chemist or anywhere and they just give it to you. Take 4 tablets in the morning, take 4 tablets in the evening. Is it going to be effective administering it in that way? Of course, no. There's a concentration that should be in the blood or in the plasma for that drug molecule to be effective. And so when you say in the morning and in the evening, you are not giving that patient. So many factors contribute to the resistance that we are suffering currently, and not necessarily the efficacy of the molecule. Now, having said that, there are diverse things that could be explored. But before you think about drug development, I want to develop a new molecule that will be effective, a novel molecule that will be effective for the treatment of malaria. You will, first of all, diagnose the plasmodium. How does it function? What are the different pathways in which it functions? So you look at it from the stage when the blood meal is taken, okay, and it injects into your body. So from that stage, you could develop a molecule that will cause a barrier. you consider the stage of when this blood meal as sporozoite is taken up by the liver cells, you could have an intervention that will stop that process going on. In the liver, when it will now develop again to other forms of chisons, and then merozoites that will be released to the bloodstream that will start causing degradation of red blood cells, you will consider a molecule that will be able to stop that process. So in the development of novel medicines, you'll be considering the pathways. It will interest us to know also that the plasmodium, the parasites, they are as wise as we are. As you are thinking of making drugs that is going to stop these processes, they are also fortifying to ensure that they build much resistance. How do they build this resistance? You take in the drugs, they will increase the efflux of these drugs from their system so that the drugs will not be effective. They will think of how they will produce proteins that will neutralize these drugs so that these drugs are not effective. They look for a way that they change their conformation in a way that these drugs cannot bind to those active sites to elicit its therapeutic response. So as you're thinking, they are also way ahead of you, thinking of how they will change their mechanisms of resistance. And so we have to explore all of these pathways if we are thinking of developing drugs that will be effective. Now, recently, researchers are also exploring the use of nanotechnologies. When we say nano, we're talking about various, I told us that in drug development, you consider the materials you are using. Okay? So researchers have come up with nanoparticles between the size range of 1 to 100 nanometer. Now, these particles are biocompatible. They are also biodegradable. They are specific in their actions and they are selective. The drug molecule will be formulated in a way that these particles will not be metabolized until they get to the site of action, and you can program its release to the target sites. So these are areas also that are explored by researchers to be able to come up with novel medicines that will be effective in tackling the issue of malaria. Collaboration, you were talking about collaboration. Yes, different researches are ongoing, but I think that's the reason why we're having forums like this, so that we can discuss. I think collaboration among stakeholders will be the best approach in tackling the malaria issue that we have as a nation or even as a state. We have heard from different panelists how different methods could be explored. They talked about the spatial repellence analysis. They talked about the larvicidal approach. We are talking about the pharmaceuticals. So different stakeholders from these fields can come together and collaborate to see how, as a state, we can have our protocols on how to tackle the issue of malaria.
All right, thank you. Thank you. It's a long talk, and yes, it's a long talk. For me, what is important here is a lot of these things are doable, but we've not created the appropriate mechanism to actualizing them. We are talking now. We'll talk, possibly come back next year and do the talk. What's actionable plans have we instituted in resolving, even if it's just 1% of what we talk here? And so it goes round and round, and over time we'll have achieved something. But we'll just talk. You are here as a pharmacist. These are some of the things that are challenges that you need to take to your own group, the Pharmaceutical Society of Nigeria, PSN, in your fora when you talk about all that. There is actually a need for that collaboration. This strong collaboration, with strong collaboration, a lot of these issues will be, resolved. Isolated studies here and there, like I said earlier. This group doing one thing or the other independently. They don't come together, a common work frame to chase some of these challenges around eliminating, because within the public health space, we are talking about elimination now. We're no longer talking about control, talking about elimination. But these things are feasible, but it's just that we are just talking. So the take home here is for us to not just talk. We should talk and walk. Now, before I leave you, you talked about the pathogenesis of malaria, life cycle issues around and all that, and the need for different drug molecules to be used at different points so we can have a holistic combat on the malaria parasite and reduce the burden of the disease. Now, the question now is this. Won't there be a need, like you said, to use available drugs? Especially, like I said, because of this resistant thing, use drugs that will have effect on the different sites within the life cycle of malaria. I remember the HIV therapy too. Initially, monotherapy, the 2 drugs. Now is 3 drugs, all acting at different points to hit the HIV virus. So, is there no effective, combination therapies that can be instituted? So, for us to have a holistic, treatment outcome.
Okay, thank you very much, sir. Let me just cite an instance on a lighter note. Now, I'm doing a PhD research on the study of medicinal plants, okay, in the treatment of fibroids. And just last night, we had a meeting. And my supervisor told us that, look, for you to be able to induce fibroids in experimental rats, establish the disease, then you use your plant molecules. Of course, you will extract the plant and get the molecule to be able to administer and get results. We are looking at a total cost of 24 million. And in my mind, it's like I will just leave this research for you, sir. So that's on a lighter note, but that's the sad scenario that we face as a people. Now, you may have the knowledge, you may have the expertise. Then you ask yourself, do you have the enabling environment to be able to do what you want to do? How much of the resources do we allocate to research as a state? When they were talking about Agbo, some of us were laughing. I also laughed. But the truth is that some of the drugs that we're using today to treat chronic illnesses are sourced from medicinal plants. We're talking about digitalis, we're talking about digoxin. It's from foxglove tree or plants we use for our cardiac issues. We're talking about even this anti-malaria now, the ACT that we're using is from Artemisia annua. It's a plant. Aspirin is from willow's tree. Quinine that we're using as our primary line of treatment of malaria, also for complicated cases, it's from cinchona as well as chloroquine. So, back to your question, sir. We have these available resources around our environment that can be explored. That can be explored to tackle this issue that is facing us like a monster. But how much resources will we allocate for research? There are these, as our director indicated, is just behind our houses where our grandmas will go pluck, we will drink and we are well. We will drink and we are well. So it's just all over. Cancer, we're talking about vincretin and vinblastine. Where is it obtained from? It's from Madagascar periwinkle plants, Cataranthus rosseus. It's a plant, and we are using it to treat cancer till tomorrow. We are using artemether lumefantrine till tomorrow. So we can still get more molecules effective for this treatment if only the government can prioritize research. We have the expertise. When you go outside the country, they will keep saying, why is it that we're here? It looks as if nothing is happening. But these same experts go outside and develop their countries and make so much impact. We don't have the enabling environment. The resources are not available. So it's also a take home that our government should prioritize the health of the indigenes and explore different mechanisms in doing this, primary of which should be research. Thank you.
Thank you very much, pharmacist Quanta Roland. This to Dr. Easter Walker. Easter is coming from the academia, and that is the hub of research. But we are for the case of malaria research, we are talking about cutting-edge research. Effective, I use the word effective, I'll use it 1 million times today. Effective cutting-edge research. We're all there. Most times, I'm in the academia too. We're doing research, become professors. We're doing research, just isolated research. And then the researches are not funded. So if you're talking about cutting-edge research, it has to be, you can talk about PhD research. She talked about, is it 20-something million? Yeah. Some few years ago, I spent 9.3 million for my PhD research. So that tells, I understand what you're talking about. And it's from my pocket. Nobody gave me. I spent it myself. So what am I saying? These all things, isolated research, purpose-driven research, because we have an objective, we want to grow. What kind of research that we need to be intentional about? Research that will go out there and get sponsorship, come up with a concept, come up with a proposal, go out to our institutions, to governments, to stakeholders, to say, look, these are things we need to do in terms of malaria control and elimination. We want to come up with research that will curb a lot of issues. What are such things that can be done within the research space that will, have a whole lot of impact? This question is.
Sorry. Okay, thank you very much for the question. Like rightly pointed out, I'm from the academia. And I was really excited when she, talked about, funding and collaboration in research. Of course, that's a major bane of research in Nigeria. And then in the institutions where we belong. My background is more of diagnosis. That's where I am. Now, if we are talking about, innovations to reduce or eliminate malaria, I would rather flow from what the world is doing. Now, when the last panel was in session, although I was a bit distracted, so I went out and came back. We are talking about RODT. So let me start from that diagnostics. Somebody said they went for inspection, they saw RODTs packed, and then many of them are useless or something. Okay. There is a trend now that we have, and that trend is many of the RODTs you use will give you negative results. The keynote speaker said, when you now do a microscopy, you find something positive. We discovered, and WHO is also making emphasis on that. That there are developing strains of Plasmodium, parasites that have HRP 2 and 3 deletions. Now you discover that the RODT that you use in the laboratory are designed to detect the protein HRP 2 and 3. Are we there? Now, if the strains that we have now spreading do not have they have the genes encoding for this protein deleted, so they cannot produce the HRP protein. In other words, if you carry out that diagnosis from now till tomorrow, it will give you negative. So it means that if we know that this is what is happening around us, we should be able to gather ourselves and say, okay, this is the strain of Plasmodium falciparum we are having here. And we are able to establish the truth of HRP 2 and 3 deletions. And then that can help us now to begin to innovate. How do we now design the kind of RODT that will be suitable for us here, and perhaps even enlarge, maybe do some kind of integrated capture of all the various strains that we have here. But because we depend on what we buy, and then you now talk about who are those that eventually make the orders, who are those that sit down to find out what we want to buy. So we have such issues around us, and then people just bring in RODTs, and then they come and dump on us here. There is no synergy or harmony between what researchers are doing here and what our policy drivers are doing. So they bring in whatever they want, perhaps by whatever cost that we give it to them, and then they bring them here and then force the things on us to use, and yet we don't get the desired result. That's on diagnosis. And of course, time will fail me to start talking about issue of supply chain and all that. So these are areas that we need to think. WHO has alerted us that yes, there are strains of malaria parasite now that have HRP 2 and 3 deletions. Issue of supply chain, is there. Those that bring those things to us, how do they come? Sometimes they come and then they are stored in environment that are not comfortable. These are things that we need to talk about. Now let me go into a little on the issue of vaccine. Now, for over 60 to 70 years now, the world has been researching on how we can, use vaccine as a method to eliminate malaria. And now, over time, we have had issues of, vaccine being tested. I like when we were talking about pathophysiology of Plasmodium falciparum. Now, one of the vaccines that has eventually scaled through and then gotten approval is the RTS vaccine that has just been that was approved in 2021. Am I correct? Yeah, 2021. That was after a lot of work, a lot of clinical trials have been done in Malawi, in Ghana, in Kenya. So in 2021, WHO gave an approval that okay, this can be used, especially for children under 5. Now that's a huge problem. You also discover that that vaccine actually targets circumsporozoites. That's a protein that is produced, and it is at the pre-erythrocytic stage. Yeah. Now that vaccine, I think it has achieved a success of about 39 or 40%. But then, if you look at the issue of sustainability, I'm talking about of the immune system now. It doesn't last for too long. Of course, WHO has said, okay, I think the child needs to be given booster doses for up to about 4 times. Then there are other candidate vaccines that are also being tested. Where we are now is that people are now asking, okay, if we do a combination of this vaccine the pre-erythrocytic, and then the transmission preventative vaccine. So if we cannot combine them, we will be able to get something that is better and superior to what has already been developed. Of course, he has said many of the things that we are doing here, everybody is working, we work in silos, and yet there's no collaboration. But sir, we have a very serious problem in terms of research funding in Nigeria. In University of Maryland, in the US, Institute of Health, you have over 1,500 laboratories manned by professors. And each of those labs, is doing something different. A line of research. Some are collaborative. Government, US government funds that institute. And so much money is there. And then that is where you actually see people come to excel. They bring knowledge. People are made to sit down there and then, research, bring out knowledge, and then work towards them, and then they come out with innovation. So I'm just saying that going forward, we can have, collaborations. We can prevail on our government. I don't know whether that's the correct word. Or we appeal to, our government. That's the primary thing that we have to do. If government gives us enabling environment, the required equipment, something can start that will now enable us to compete globally. So if I want to put an application for funding, for example, I was wondering, there was the last call for TED fund applications. So many people submitted applications for TED fund. You see 50 million and this, that million and all that. And then I was wondering, okay, if somebody says we have pre-qualified you, so your concept note is accepted, let us now get to the stage of proposal. And we send a team from TED fund to come to some of our investors. Okay, show us the lab where you want to carry out this work. You fail. And these are serious challenges. I think maybe I'll stop here for now.
Okay, thank you. Quite.
Thank you.
Yeah, quite educative. But before I leave you, I would just look at one aspect too. Yeah, in spite of the fact that we don't have effective collaboration and all that, I'm looking at how can we strengthen the issue of translational research from the bench to the bedside. We do a lot of researches at the bench, and the products of these researches are not translated to the bedside for application. I did a research some years ago. I was trying to compare the effectiveness of serum cystatin C and serum creatinine, in assessing glomerular filtration rate. I was importing strips with my money from China. And my sample size was 400. It was 373, approximated to 400. All on me. I did that work, went through a whole lot, and came up with fantastic results. That first time, so much contribution to knowledge. But they are in my system, my laptop is there. But of course, over time, I'm happy that even in most of our facilities, diagnostic facilities now, they've seen the real importance of using preference of cystatin C over serum creatinine and all that. That is gradually creeping in. Even in our own teaching hospital too, cystatin C is used more in assessing glomerular filtration rate. But I did it some years ago, and it's lying there in my system, abandoned. So how do we strengthen this bedside, bench to bedside? How do we translate? How do we enhance, strengthen translational research for effective, even malaria issues we are talking about? How do we do, all that to reduce the burden of malaria?
Okay. Let me start by saying that we need collaboration. We need to extract, trust from funders. We also need to be forward-looking. Let me just give an example of what happened some time ago. So I was doing, my master's, and I was working on bloodstream infection, or looking at, antibiotics resistance of organisms from bloodstream infection. Now, in trying to do that work, one of my intentions was that the result of that work should actually be used within the hospital where I was working. I tried to look at the antibiotic policy of the hospital. I'm not a doctor, so I don't go about administering antibiotics. But I can make something that I will see in the lab, and then that will help patient care. Now, for those who manage pediatric patients, I think as at that time, I think if a child or a baby unit, is born, and then there is high suspicion for neonatal sepsis and all that. I think you give ceftazidime, and then perhaps is gentamicin or something, as per policy. Okay. Now we discovered that that was the policy. As soon as that happens, the drug is not administered, the blood is taken, and then we come to do a blood test, and then eventually we send back the result. So you draw the blood, we carry out a blood test, and then you continue your treatment. Then we return our result, and then you can now compare and manage. Now at the end of that work, I'm talking a personal experience. When we analyze our data, we discover that we have over 1,003 isolates. That work was done for 12 months. Now, when we analyzed and then saw the antibiogram, we discovered that, I'm talking about Professor Obonge, was part of the work. And then when we analyzed the data, and I said, oh, it means that what we have been doing is actually wrong. So this work can now inform a change in. Are we there? So we have had something that we have done that eventually informed a change in policy. Okay, let us alter this antibiotic policy in the place. And that is very, very important. Now we have a situation, because we are talking about translational research. Organizations must build that trust. But you cannot get there if you have not started somewhere. I was privileged to get to a conference, sponsored conference outside this place. And then I saw an organization, one Elizabeth Griffin's Foundation. Yeah. And then Elizabeth Griffin's Foundation. They're into biorisk and all that. A lot of research in virology and so. So they came and they said they want quality research. They have, in fact, they man demonstrate and say, we have money. So what am I saying? An organization must be able to extract, trust, confidence. To be honest, many of us who are in academics, many of us are just struggling. You find some money, you put it somewhere here, and then somebody says, go and publish this work in a quarter one, quarter two journal and all that, and then you don't have the money. Maybe you are not very visible. But how can we do translational research? We need to collaborate. We need better funding. We need better equipment. That can help us to start from somewhere. Then somebody sees us and says, okay, I think I can come and endow a professorial chair on this matter. So you handle it, because we have built some expertise and confidence, in this area. So when you do that, somebody cannot trust you and say, I know that I'm investing in this person. You are talking about 24 million. Convert that 24 million to dollars. It's not. It's less than $20, $20,000. And then somebody is prepared to make that investment, provided he knows that there is something that translational about what you're doing, and then they can get value for their investment. So I think if we do this, we'll begin to match there. Thank you.
Thank you. Thank you to the last speaker, Dr. Veti Agala. She is a specialist in healthcare financing, and this question is to you. You are actually, though, you know, because you are even the executive secretary of Rift Chip. The reasons behind River State. The reason, sorry. All right. The reason behind the your organization was well thought out. The governor of River State saw a reason. He knows our peculiar issues, economic issues, the burden of disease. He knows that the out-of-pocket expenditure for healthcare is not sustainable because of alarming rate of the burden of diseases in the state. So they came up a novel one to, see how Rivers people can assess quality healthcare, which you are doing. Now the question is this. Within your space, you know that bulk of the feedbacks you get are on malaria, especially in our rural settings, riverine rural settings. So many of those areas are bewildered with malaria. Now, how can your agency, via the health insurance program, improve access to malaria prevention and treatment services?
Thank you very much, and thank you to my co-panelists that have educated me so much in this last few minutes. We're talking about innovative healthcare financing, and health insurance, of course, is one of the ways. But let me back up to, because we're talking malaria, and it's so important because the other two speakers have hinged a lot on financing. And so healthcare financing, one, is about mobilizing resources. You have to get the resources. And then two is about pulling those resources somewhere. And then three, about strategically deploying those resources. So whether it's for research, whether it's for treatment, whether it's for training, for engagement of human resources, all of that. So healthcare financing actually is one of the pillars of the WHO building blocks for healthcare systems. And so if we're talking malaria, it means that we need to look at malaria more holistically, and then, of course, infuse health financing. So back to what you have said, we have implemented the River State Health Insurance Program for 1 year now. And over the last 1 year, more than 70% of our utilization is on malaria treatment and care. So it's very obvious. And of course, research has shown that over 132 billion is spent annually on treatment of malaria. And more than 60 to 70% of our populations are paying out of pocket for their health care. So it was a strategic move for the government to say, let us have an agency that will ensure that everyone that lives and works in River State is able to access healthcare, and in this case, malaria, as simple as I have said it is, malaria care, whether it is for diagnosis, prevention, or treatment, without having to pay out of pocket, or without becoming poorer because they had malaria. And so what we have done so far is to is almost like putting everybody together. We're talking about collaboration. Malaria care and treatment, malaria elimination program is one of the major programs of the Ministry of Health. So it has always been there. And so have other program heads been there. But what we are doing at the River State Contributory Health Protection Program is to look at the person as a whole human being. And just as Prof said, everybody comes with malaria, then they associate typhoid with this. What am I saying? I'm saying that malaria is not the only problem. With it comes so many other problems. And that's why having a healthcare coverage that meets the common needs of populations, and that's what our benefit package embodies, the commonest problems in our population. So whether it's malaria, whether it's arthritis, whether it's hypertension, whether it's diabetes. So what we are doing now is to ensure that not just the vulnerable populations, because we cover the vulnerable populations under 5, pregnant women, elderly, who are more susceptible and who are more affected by malaria. I mean, some of us, we have the malaria, we still came here instead of going to get a test or getting treatment, but we're here and we get by, sometimes without actually taking treatment like we have said. So the agency is here to ensure that everyone that is covered can access malaria diagnosis, can access malaria treatment, whether it's acute or it is, severe or uncomplicated, whatever it is, they can access it. Now, another thing that we bring on board is one of the issues that Prof raised when he was presenting. So we have all of these innovations, we have programs, different programs, some of them actually vertical. But do the people know what they need to do? Because malaria prevention is beyond our diagnosis and treatment. No, we don't want to get there. We want to prevent malaria. We want to eliminate. And so a lot lies outside of the hospital for us to get to where we want to go to. Thank you.
Thank you very much. That's a very good one. The other one question is, what are the challenges and opportunities for this 1 year you've encountered in scaling up innovative healthcare financing models for malaria control and elimination?
Thank you very much. So I back to when I started to say healthcare financing is about pooling funds. For us to be able to strategically purchase, for us to pool as an insurance agency, we need to generate funds. And so the innovative ways of generating funds, one is tax. And that's a government function, isn't it? And so one of the innovative ways is about whether sin tax or any of the taxes, and ensuring that a percentage of that is used to cover lives. Remember, we're using malaria as a case note or a case study, but then it's actually more than malaria. Malaria is just the most common illness to use for this. So ensuring that governments can pull in funds. The Abuja Declaration talked about 15% of the revenue of the country or the states being allocated to health. But where have we been over the years? We're still, as a country, struggling between 4 and 5%. Sometimes we go up to 8 in a state, maybe because we are building infrastructure or doing one thing or the other. So we need to put our resources where it matters most. And that is one of the innovative ways to think, reimagining how to spend this much money that we are already spending. Before we are looking for more money, how can we get more health for the money that is already available to us? And so for us in the last year, we have had funding to take care of poor and vulnerable persons. We have also rolled out our informal sector plan, because you have to stratify the community or the population. And so you have the formal sector, who are those that work for whether the government or organized private sector, and they have a scheme that covers both individuals and their households, a spouse and 4 children under 18. That is co-funded by the employer and the employee. But yet, we have more than 70% of the population who are not working for government. And so, there are plans which we have tagged the Reef Care plans that speak to the vulcanizer, the driver, the boiler seller, anyone can pay a premium of as low as 15,000 in a year to cover that individual, and you access all the basic services that you need to stay alive. Remember, the idea of universal health coverage is not to take care of highfalutin or very technical problems. No, the things that are killing us are malaria, they are diarrhea, women are dying in pregnancy, and all of these are covered. And so we have that plan to see that individuals, if they pay that token, they can access healthcare when they need it. We also have a plan that covers children under 5, the pregnant women, elderly, people living with disability, and as many people as we have categorized as vulnerable. Poor, through our means testing, they are covered. And today we have about 92,000 persons enrolled into the program across the 23 local governments. Please clap, you can clap. Across the 23 local government areas of Rivers State. And we are just a year old. We started our first enrollment on the 11th of April last year. And so we are actually just 1 year old, even though the law that established the RIF chip has been passed since 2021. So our challenges are challenges that we don't want to call challenges. We look at them as opportunities. In the last 1 year, we've seen joy in the lives of people. And so we are excited that this is working. We've seen people have CS and they are so excited. They are praying for, the entire leadership, whoever has made this possible. One of our concerns, and I don't want to say funding because we are the funding people now. I'm the one that should talk about funding. But I want to redirect us to be more efficient as a way of domestic resource mobilization, because that's what we should be doing. So the funds that you have, I can tell you that I had a target of 68,875 lives given to me. And that's what the Basic Healthcare Provision Fund, NHIA Gateway, pays for. But I have stretched that fund to cover 100,000. So that means that we can do more with less. But we need to ensure that there is a mind shift from the patients to understand and to begin to trust the government and to trust the healthcare providers, to the healthcare providers having better attitude towards engaging our clients, not because they are poor, but because they are humans and they have dignity and they should be treated with respect. And for government also funding what they need to fund part-time, whether it is covering those who cannot pay for themselves or paying a counterpart or providing equity funds as stated in the laws to ensure that everyone can actually access this healthcare. Thank you.
Thank you. The very last one. Now, with the expanding public image of RIF chip, you can agree with me that our people are more interested in it now. There's a lot of consciousness about it. And so still coming back to innovative funding, is there no place for partnership? Partnership in terms of, because as it is, malaria, the hyper-endemicity of malaria, it's clear. It's one of the killers amongst the vulnerable population. We're talking about under 5, talking about pregnant women and all that. So it's a serious burden. And so with this good public image of rape chip, won't there be a need for partnership to, form of support what you are doing? Have you looked at it? The need for partnership, public sector areas, private sector, organized societies, international fundings, and all that. Wouldn't there be partnership for this, high endemic disease?
Thank you so much. Of course, we thrive on partnerships. We thrive on collaboration. I mean, we are here because the Reef Chip is actively collaborating with ERENS Foundation to have this conversation. And so partnership is not just about one big organization or an international agency. Partnership can be from individuals. It might interest you to know that you sitting here can pay for a life. And that's partnership. You can cover 5 lives, you can cover 10 lives. You can adopt communities to ensure that they are covered under the health insurance scheme. We have partners that provide sometimes technical support, sometimes as simple as transportation, as simple as NIN, because NIN is now a prerequisite for enrollment into the health insurance scheme. And so you find that so many people at the rural area, they don't have the NIN. The NIN people are not going to register the people. So they can't access the care, even though they are poor and vulnerable. So you can take that on in your community and say, okay, let me pay for the NIN so that my people can access care. As mundane as that is, we're having conversations with associations of communities and professional groups, even in diaspora. We're having both in country, outside, and so there's a lot. Grant writing is something we intend to start doing, and I was going to say that there's a lot you can do to get grants for some of the research that we are doing. So for us at Reef Chip, less than 1 year, we had already submitted an abstract to the West Africa College of Physicians November, and we did a presentation. So we're not just doing work. We are constantly looking at our data. We are fully digitized. I'm here, I can look at my phone and I see who is being enrolled. My enrollment team, they are in Bonny as we speak. And so I can see numbers dropping. I can see who is accessing care in Obonoma. I can see exactly what is going on, who has put to bed, what is happening, who is being referred to one secondary facility, private or public. And so we look at these data every day, and that informs our decision. So it's not just one of those government agencies. We are here to ensure that Rivers people actually enjoy the purpose for which this organization was established. And you may say, oh, I can afford it or I can't afford it. But you see that every action each and every one of us here takes affects the people down in the rural area. And I know that not all of your people are in Port Harcourt. You would have an aunt, you would have an old woman, someone that is there to you out there in the rural area. And those are the lives we intend to touch. So we are very excited even to work with pharmaceutical companies, because one of the concerns we've had has been out of stock, and that's something that we are dealing with. I have been in conversations with the director of pharmaceutical services and the head of CMS to ensure that none of our clients is told this medication is out of stock. So we granted that we cannot give you brand names, but we know that our generic drugs, as effective as we find them to be, will be available for our clients. We have had people refund money for taking payment for a service that is covered under our benefit package. So our partnership with you is also to look into what we're doing. Find out what's going on in your environment, give us feedback, and we are very, very responsive to ensure that our people get quality care. Thank you.
Oh, thank you very much. It's been a very robust session. Yeah. So are there questions we can quickly take? Yes. One. Yes, any other? Two. So 2 questions. So we'll go. So give him 1, then 2.
Thank you very much. My name is Dr. Wukoma Hakot, and I'm from the field of business. I appreciate the fact that you have established a whole lot of points, especially from the pharmaceutical industry. From my training, I know that every organization is bound to make profit, and you are out there to make profit. My question is, is there any compromise with respect to the pharmaceutical industry, with respect to benefiting from this persistent issue of sickness and diseases? Because during COVID, we got a whole lot of conspiracy theories around. In Nigeria, I want to ask, are we looking out? Is there anyone existing? Because people produce products that will always spoil so that we can still come back. I'm from the business school, so I want to come from that perspective. That is just a question I want to ask. You are out there as a pharmaceutical industry to make profit, and this thing is never ending. Malaria is not an exception. Are we looking out for such to stop them so that we can also stop this whole issue? Thank you. That's my question.
All right, next.
Good afternoon, ladies and gentlemen. I don't know if mine is a question, a contribution, or a statement. And we've said a whole lot, and I appreciate everything we've said here today. But then I'm a bit disturbed because I'm coming from an environmental engineering background. And what we do is we destroy at source. But then we are talking about correction, instead of preventive measures. And by prevention, I mean, how do we reduce the breeding of this malaria-causing mosquito? We are talking about drugs. When we can talk about stopping the spread, stopping the breeding. I know that in Bonny they may succeed because it's a private entity that is handling it. We don't have the political will to do it. Some years ago, we saw a helicopter flying, spraying us water everywhere that they want to prevent mosquito. Instead, mosquito increased. So let's talk about how do we stop the breeding of mosquito causing, not treating. Thank you very much.
Let's give her.
I'm very sorry. Okay, thank you so much. Continuing from where he stopped, mine is more of a comment. It's that individuals should take responsibility. We can sit here and blame the government all we want. But sorry, let's take a census. How many of us have mosquito nets? How many of us clear the bushes around our houses? That's his point. If we are doing the things we are supposed to do, some of these things will be minimized. Then, okay, a question to her, the financial, healthcare financing. I don't know if it's me that is not really checking, but apart from, I heard a lot from you and I was really impressed. Are you really trying with publicity? Like, I feel like she mentioned that there is so much, you guys have done so much, but bringing it down to the total population of Rivers State, it will look like what you've done is not enough. So, is there that active publicity to make sure that people know they can access healthcare at a very minimal amount, or like, is there publicity basically? Thank you.
Okay, thank you very much for that question. Just to add to what she just mentioned about taking responsibility as individuals. I know. I just want to say something. Okay, just this morning, I realized that something as little as having your bath in your house and keeping water in a bucket is a breeding ground for these mosquitoes. I just realized that recently. You know, because usually when I bathe, I remain water in the bucket. And this morning I found out that actually it's a breeding site for mosquitoes. So we really need to, you know, take responsibility as individuals. You're right on that. Yeah, so coming to the question he asked, pharmaceutical industries intentionally maybe giving us medications that are ineffective so that they can make profit. Well, I'm an administrative pharmacist and a clinical pharmacist. I'm not in the industry. So I wouldn't know what the pharmaceutical companies are doing. However, I will speak on the premise that in every pharmaceutical industry, we have the production pharmacist. And I know that every pharmacist swears to an oath to do what? Save lives. So in that regard, and there is no production that will go out without the input of that production pharmacist. So in that regard, I will say no to as a response to your question. Now, when I was talking, I did mention that yes, we're talking about novel medicines for the treatment of malaria. However, we should rather explore a multi-pronged approach. I did mention that. And I also gave an instance of how we take our medications and how it can contribute to what? Resistance. I cited ACT as an example. How we would take 4 in the morning and 4 at night and expect that it will be effective. So over time, what are you doing? You are giving room for resistance. So there are so many things that we could do as individuals that will contribute, okay, to reduction in the burden of the malaria prevalence or incidence. Now, look at it from this angle again. We have so many fake, so many substandard, so many adulterated drugs. Prof even mentioned that sometimes when you take this medication, it looks like chalk. Do we have these pharmaceutical industries producing these drugs? You and I know that the answer is what? No. You go to Aba in someone's 2-bedroom flat. It's a production industry, right? You go to the open market, there are regulations, yes, but maybe because people are not brought to book, people are not held accountable for their actions, everybody wants to handle drugs. Somebody's backyard, they are manufacturing drugs. And when they package these inactive, inert, we call them inert substances, and package them as drugs, they bring it to the street, and you and I, most persons don't know how to differentiate or distinguish which one is what? Fake, which is substandard, which is adulterated. Now, thank God for what NAFDAC is doing recently. We will be able to trace products. When you pick up your medication, you walk into any pharmacy or you go to any hospital, they give you any drug. Please, there is a pad that you can just scratch. There are pins there. Authentication figures are there that you can just send to a code and immediately you will get your response. We have mobile phones with us. We have the NAFDAC Green Book now. Before you will even patronize a company or patronize anyone to get your medications, check, are these medications they are giving to me, are they enlisted in that Green Book? So for product authentication, you can get that so easily from the pack of the drug. You can go to the NAFDAC Green Book. So there are product traceability apps all over. Just on Google, you get these apps downloaded on your phone. And with the QR code, you'll be able to know which drug is actually registered with NAFDAC, which drug is actually fake, and all of that. So we can also have this education and also cascade it down to our household so that everybody will know that for any drug that you purchase, please, you can have this. There are scratch pads that you can just scratch, get the pin, input, and you get your result instantly. So you don't need a pharmacist to know which product is fake or not. So that can also help us. Because when you take all of these innate substances and some other ones that God knows what they formulate in those capsules and you drink, of course, we know that every drug is a potential poison, right? So when you're now taking all of these medicines, eventually it will accrue to what? Resistance. So please, my brother, no pharmaceutical industry would formulate medications that are ineffective or inactive. Thank you.
All right, thank you. Let me start by saying, let me start with her question. She's asking, do we know, are we out there? We need to keep being out there. Ordinarily, I will tell you we're out there, but there's so much more to do. I mean, we're a population of over 9 million. What we've done is basically 1% of the population. But I like to tell my team that they are doing great so that they can do a lot more. And I think as a young agency in 1 year being able to do that, I think they deserve some accolade. But there's more to be done. And so we use various strategies to reach out. The people that are here, I believe we can all bring out our phones. Moderator, please permit me to do this. Please bring out your phones. If you're on Facebook, you can just find us at River State Contributory Health Protection Program. If you're on Facebook, if you're better with Twitter, please just go to RVCHPP at RVCHPP if you're on Twitter. Not just like our page, follow us, you would get to see what we're doing. If you're on Instagram, if that's where you spend some of your time, you can get us at RIVCHPP, that's at Rift Chip. And then you can actually go to our website, RIV, that's www.rivchpp.rv.gov.ng. Maybe you should write it so that we don't take too much of our time. www.rivchpp.rv.gov. I'm too fast. It's like the poets. Okay. Let's start with the website. Let me not say okay. www.rivchpp.rv, which is rivers, rv.gov, government.ng. So did we get that? rivchpp.rv.gov. You can just go there and you'll find everything. You can actually self-enroll through that platform. You pay and you can get even a temporary card that shows your details. You can choose a facility where you want to access care. Okay? So, but social media is where you find us very often if you're out here in the city. In the rural area, we work with the community structures. So we work with the CDC. We have the World Development Committees as a team that we're working with because we are ward-based and we use the public health facilities and private. So young lady, please follow us so that you can get more information and reach out to others. And then back to our Nance, was it Nance? Graduate student, sorry sir, sorry. So I think we've talked about some of those things that are not just government responsibility. And I did say that we don't want you to be sick. Even if I want you on my health insurance program, I don't want you sick. Because if you fall sick, you're going to, impact on the funds. And so one of the things we do is health education. Because, hey, we may pay your bills, but we can't carry your pain. We may be able to pay for your malaria treatment, but you're the one on the bed. You're the one that will have an infusion or whatever it is that treatment will entail. You're the one that won't go to work. So we can't take care of your intangible cost. So one of our strategies is to ensure that people stay healthy. And so if you are on the scheme and you say, oh, I don't fall sick. No, you don't have to fall sick. We ensure that you have your annual screening. It's covered. So if by 6 months, 7 months, you haven't assessed care, we're likely to call you to say, hey, have you done your medicals for this year? Perhaps on your birthday, I think we should even do that. Call you up to say, have you done that screening for your birthday? So instead of gallivanting and eating all the wrong things, perhaps you should use that time and fund to ensure that you have your screening. So people need to take responsibility. People need to take responsibility to clean their environment. You do indoor residual spraying, you do biolarviciding, you do it here, the mosquitoes move there, you move to that place, they come back. It's as simple as that. What did you expect? Except you're going to do it simultaneously across. So it behoves on us not to keep any stagnant water. And she has told you that stagnant water in your house, maybe you have a drum, isn't it? That's the common thing that some people, you have a drum of water to store. You leave it open, mosquitoes will breed there. Is it government that will come and move it for you or cover it? Who is government? You and I are government. So keep your environment clean. If we have stopped sanitation, still do your sanitation in your environment. Government will not do everything for us. So I'm saying this to say, while government is trying amidst all of the constraints from political will to actual lack of resources, because there are competing priorities. We're here talking health, but there's education and it's very important. There's security and that is even very important. So government has to prioritize and reprioritize per time. So we can't dump everything on government. Our role is to do our bit, the academia to come up with compelling evidence to take to the policymakers to say, this is what we need to do for this to happen. And that's where they come in. And then government can say, oh, okay, we can fund this. Years ago, we did a study on, I think before now, pregnant women would just have urine testing for glucose. But now we know that there is value in ensuring that there is a blood test. It is science, it's research, it's work. You bring it, then we can move from the bench or from the gown to town, all right? So, but I believe that all of us seated here have a role. We are all key players and stakeholders wherever we're coming from, and we have so much to do to make malaria a forgotten issue for us in Nigeria. Thank you.
All right, thank you very much. In a nutshell, we've had, like I said, a robust discussion for this second panel. What the summary of it is two major things: collaboration and funding. For us to come up with effective, innovative ideas, there's a need for collaboration between the drug companies and those that do research. Collaboration, effective collaboration. Amongst researchers, effective collaboration for translational research, so we can get our research findings from the bench to the bedside. Of course, funding for healthcare financing, also in terms of disease diagnosis, treatment, prevention, funding. So that is the central point of our session now. So thank you for the time you've given to us. Thank you for listening. Thank you. Thank you. God bless you.
Thank you, thank you. You can do better, you can do better. Ladies and gentlemen, let's make welcome to the MIC, someone that will thrill and entertain us for some minutes. Give it up for Mega Star. Clap, 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 clap. We are done with lectures. Let's enjoy. Yeah, he's good. You will see that for yourself. Just 3 minutes.
So, good afternoon, Mega Favor, also known as Mega Star, 300 level medical laboratory science student. Yes. Yes, and also the first faculty director of socials of our department. So, yes, thank you very much. It's a popular song. Also, this is my flyer on the screen. I do weddings, birthday surprises, engagements, events, and all kinds. Thank you. It's a popular song, and please sing along. Thank you.
About the good times that we shared together, baby, I cannot understand how we ever let things go this way. I shouldn't have let you go. Yeah, let you out of my sight, baby. Maybe we shouldn't have known. Wherever I go, wherever you are, baby, you're never far away. You're always on my mind. Oh, mi tata, you always take my mind. Body me gone. I cherish you with my life. No worry yourself. Like say, nobody sent you that one I did for you, my friend.
Thank you very much.
Wait, no play. Killer. No play. Give me guitar. Because as a day I sing, I never sing. Nobody clap for me. Oh, sing it.
Like an angel in the morning, shooting stars across the night. The most beautiful girl I've seen.
Now, see normally I don't do this. And when politicians won't like give you that. Yeah. Because of what you did, Spiff begged. Killer. Spiff has begged me. My show is coming up July 13th. You'll be doing a 10 minutes performance, so consider that your first gig. Yeah. Madam, you're here from Reef Chip, eh? Now, she talked about publicity. True, I didn't know about this until now. Yeah. So if you have a clip, right, we can play it on my show just so for that create the awareness. See charity, I just did do. Oh boy, I just do charity. You are level 300. And you sang 2 songs. Love, love, love. Sir, you're too. You're singing about love. Okay. Let's wait for your results. Oh no. Ladies and gentlemen, at this point in time, we'll just have to take a few.
I was thinking that maybe you actually calling me to come and then do a performance, probably to sing.
It will be a disaster.
I was actually taken by surprise when you said it's a Goodwin message. Well, notwithstanding, we all know what mosquito is to all of us in Nigeria. Despite how simple mosquitoes they appear, but their action are extremely devastating to our coexistence and our well-being in Nigeria as a whole. Permit me once again to stand on the already establish protocol. First and foremost, let me say, Mr. President, the ERENS EKPRIKPO Foundation of Health and his other contemporary, they have been doing very well to ensure that healthcare deliveries gets to our different communities in Rivers State. They've done so well, and we can attest for a period of 4 years now, they have embarked in reaching out to various communities in respect of how malaria can be controlled and eliminated in our various communities. Once again, I want to encourage corporate bodies, persons, and government agencies that has been collaborating with them, and more people to give them that enabling environment for them to do the needful to ensure how we can innovate and eliminate malaria in our various communities. At this moment, I'm actually representing the Rivers State University Alumni Association of Abuja branch. I happen to be the chairman, and we are supporting, collaborating with EKPRIKPO Foundation of Health, and I believe that today is just the beginning of what has been happening for the couple of years, and we are going to do the needful, support them, encourage them to ensure how they can take the elimination and eradication of malaria in our communities to the next level. Thank you very much, and God bless you.
Thank you, sir. Wow, what an amazing day it has been. I must say indeed that I'm very, very excited to be here. ERENS, I'm very proud of you and every other person that collaborated with you to ensure this occurred. I was just whispering to him earlier on that this is such a wonderful event. So many things have been taught here. We've actually learned new things, been aware of new innovations and new collaborations and new things that are going on within the state. And this information should not just be within the state. I think it should actually be around the nation, because there's so much that we've learned from the pharmaceutical companies and also from Reef Chip, what they are doing, from the professors that are here, the lectures. There have been so many levels to this and so many things to have achieved. And I'm really hoping and praying that next year we will go bigger, we will go global, and will be more visible so that this can be shared to every other person that is here. I also want to permit me to derail a bit to appreciate ERENS' mom for being here. Mom, you'll be really proud of your son. So to everyone who has stayed this far, thank you so much for being a part of this. And honestly, I cannot say I'm looking forward to next year. Congratulations. Thank you.
Thank you. Ladies and gentlemen, before Spiff comes up and officially close, thank you for coming. Thank you for being a very good audience. I really appreciate you. My name is Brownson. Hopefully, I would like to see you next year. Till then, I'm out.
Thank you. Thank you very much. My professors here, everybody, we are most. The Lord, oh, to the Lord. Glory must be to the Lord, to the Lord. Is worthy of our praise. No man on earth should give glory to himself. All the glory must be to the Lord. I'd like to thank you once again from the depth of my heart. May God bless you all in the mighty name of Jesus. Let me pray so that I can close. Abi? Father, we thank you. Lord, we bless your name. Thank you for bringing us thus far. It is not by our power, it is not by our might. It is you. It is you from the beginning, it will be you till the end. Thank you for the strength. Thank you for our partners. Thank you for our panelists. Thank you for our keynote speaker. Thank you for the deliberations. Thank you for our partners. Father, we bless you for all those resources, wherever it came from, for all those that... Hold on. Please, we have a lot of food. Just go through the food routes and take as much as you can. Just go through the food routes. Take as much as you can. It's all for your consumption. God bless you.
That's how everybody's everybody.